The trauma bay doors slammed open. Blood pooled across white tile as paramedics wheeled in a federal transport officer with his chest torn apart by military-grade ammunition. The entire emergency room staff froze, except for one nurse in faded blue scrubs standing near the supply closet. She was 43 years old with blonde hair pulled back tight, exhausted eyes, and the kind of invisible presence that let arrogant doctors talk over her like furniture. Nobody at Ridgemont Memorial Hospital knew her real name wasn't just Hayes, the night nurse. Nobody knew she'd once kept 11 soldiers breathing through a 72-hour firefight in Kandahar. And nobody, especially not Dr. Marcus Reed, the cocky trauma director who humiliated her nightly in front of interns, had any idea that the quiet woman they treated like incompetent trash was about to become the only thing standing between them and a federal conspiracy that would burn their careers to ash. Before we dive in, stick with me until the end of this story. If it grabs you, hit that like button and drop a comment telling me what city you're watching from. I want to see just how far these stories travel. The fluorescent lights in Ridgemont Memorial's emergency department buzzed like dying insects at 2 in the morning. Victoria Hayes stood at the nurse's station filling out discharge paperwork for a teenager who'd fractured his wrist skateboarding. Her scrubs were the same pale blue she'd worn for 6 years, faded from industrial washing, slightly too big in the shoulders. She'd bought them secondhand. Nobody noticed. Around her, the night shift hummed with the usual chaos. Monitors beeped. A drunk man shouted obscenities from curtain 3. Someone's phone kept ringing unanswered at the front desk. Victoria finished her notes without looking up, her handwriting neat and efficient. Unremarkable. That was the goal. Unremarkable kept you off people's radar. Hayes. Dr. Marcus Reed's voice cut across the department like a knife scraping porcelain. He was 37, athletic, with the kind of sharp jawline that looked good on hospital promotional materials. His white coat was crisp. His confidence was suffocating. He stood near the trauma bay entrance with 2 residents trailing behind him like anxious puppies. Yes, doctor? Victoria turned toward him, keeping her expression neutral. The crash cart in Bay 2 needs restocking. You know how to count supplies, right? His smile didn't reach his eyes. Or should I get one of the competent nurses to double-check your work? One of the residents, a young woman named Dr. Patel, suppressed a smirk. The other kept his eyes on his tablet, uncomfortable but silent. Victoria nodded once. I'll take care of it. Good. Try not to mix up the gauze and the bedpans this time. Reed turned away, already laughing at his own joke. The residents followed. She didn't react, didn't flinch. She'd heard worse in briefing tents with incoming mortar fire shaking dust from canvas overhead. She'd been called worse by men whose intestines she'd shoved back inside their abdomens with her bare hands while they screamed. Dr. Marcus Reed, with his expensive watch and his ego the size of the Rocky Mountains, was just noise. Victoria walked to Bay 2 and began methodically checking the crash cart. Her hands moved automatically, organized, precise. Epinephrine, atropine, amiodarone, everything in order. It always was. She'd restocked this cart 40 times in the last month. Reed knew that. The insult wasn't about competence. It was about reminding her where she stood in the hospital hierarchy. Bottom rung. Always bottom rung. Hey, Hayes. A male nurse named Trevor appeared beside her, holding 2 cups of vending machine coffee. He was maybe 26, earnest, one of the few people who didn't treat her like a relic. Figured you could use this. Thanks. She took the cup. It was lukewarm and tasted like burnt plastic, but she appreciated the gesture. Reed's an asshole, Trevor said quietly, glancing toward the trauma director's office. Everybody knows it. Doesn't matter. Sure it does. You've been here longer than half the attending physicians. You know more about emergency medicine than... Trevor. Victoria's voice was soft but final. It doesn't matter. He opened his mouth, thought better of it, and nodded. Yeah, okay. They stood in silence for a moment, the hospital humming around them. Then the radio on Trevor's belt crackled to life. All units be advised, mass casualty incident en route. Federal transport convoy attacked on Highway 34, multiple casualties, ETA 7 minutes. Repeat, federal transport under attack. The emergency department transformed instantly. Dr. Reed burst from his office barking orders. Nurses sprinted toward supply rooms. Residents scrambled to clear beds. The drunk man's shouting got drowned out by controlled chaos. Victoria set down her coffee and moved toward the trauma bays. Her pulse didn't spike. Her hands didn't shake. She'd done this before. In places where backup never came and supplies ran out and people died screaming in languages she didn't speak. "Hayes," Reed's voice boomed. "Get to triage, check vitals, and stay out of the way when the real doctors start working." She nodded and took her position near the ambulance entrance. Through the glass doors, she could see flashing lights approaching fast. Red and blue bounced off wet pavement. It had rained earlier, leaving the streets slick and reflecting. The first ambulance screeched to a stop. Paramedics threw open the rear doors. Gunshot wounds to the chest and abdomen, massive hemorrhaging, BP dropping fast. Yes. They wheeled the gurney through at a sprint. Victoria caught a glimpse of the patient, a man in his early 40s wearing shredded tactical gear soaked black with blood, federal patches on his shoulders. His face was gray. His breathing was shallow and wet. "Trauma 1, Reed pointed. The gurney disappeared into the bay with Reed and his residents swarming around it. Victoria started to follow. "Hayes, I said triage." Reed didn't even look at her. "Next patient." She stopped. Watched them through the window as they cut away the man's gear. Something cold settled in her stomach. She'd seen wounds like that before. High-caliber rifle rounds, armor-piercing, military grade, not the kind of weapons used in random highway robberies. The second ambulance arrived, then the third. More federal officers, all wounded, all critical. The emergency department turned into a war zone. Blood on the floor, shouting, machines screaming. Victoria moved between patients mechanically, taking vitals, starting IVs, keeping her head down. But her eyes kept drifting back to Trauma 1. Something was wrong. The monitors showed erratic patterns. The man's oxygen saturation kept dropping despite the ventilator. His blood pressure crashed and spiked and crashed again. Through the window, Victoria watched Dr. Reed ordering transfusions, barking at nurses, moving with the kind of aggressive confidence that looked impressive to people who didn't know better. But he was missing something. She could see it in the way the patient's chest moved, the angle of his breathing, the specific pattern of his deterioration. She'd seen it 17 times in field hospitals across 2 deployments. Internal hemorrhaging from a torn thoracic aorta. If Reed didn't open his chest in the next 4 minutes, the man would die. Victoria set down her clipboard and walked toward Trauma 1. Dr. Patel stepped in front of her. "Hayes, you're supposed to be in triage. Let me through." Dr. Reed gave specific instructions. "Move." Victoria's voice didn't rise, but something in her tone made the resident step aside. She pushed through the door into Trauma 1. The room was crowded. Reed, 2 residents, 3 nurses, a respiratory therapist. Everyone moving, talking, machines beeping in overlapping urgent rhythms. "His chest needs to be open," Victoria said clearly. "Now. He's bleeding into the thoracic cavity." Reed spun toward her, eyes blazing. "What the hell are you doing in here?" "His aorta is torn. You have maybe 3 minutes before we—" "Get out!" Reed's voice was ice. "You're a nurse, Hayes. You take blood pressure and empty bedpans. You don't diagnose trauma patients in my bay." One of the nurses, a woman named Sandra, who'd worked with Reed for 5 years, spoke up hesitantly. "Dr. Reed, his pressure just dropped again. Maybe we should consider, Consider what? A washed-up nurse who thinks she knows more than a board-certified trauma surgeon?" Reed turned back to the patient, adjusting IV lines. "Increase the fluids. Get another unit of O-negative ready. And somebody escort Hayes back to triage before I have her removed from this department permanently." Victoria didn't move. Her eyes stayed locked on the monitor. The patient's heart rate was climbing. His pressure was bottoming out. 60 seconds, maybe less. "You're going to kill him," she said quietly. The room went silent. Reed's face flushed dark red. He stepped away from the patient and walked directly into Victoria's space, close enough that she could smell his expensive cologne mixed with coffee. "You think you can do my job better than me?" His voice was low, venomous. "You think your little nursing degree gives you the right to question my medical decisions? I think you're letting pride blind you to what's happening right in front of you." "Get out!" The flatline alarm shrieked. Everyone's head snapped toward the monitor. The patient's heart had stopped. His chest wasn't moving. The ventilator wheezed uselessly. "Shit!" Reed lunged back toward the patient. Start compressions. Get the crash cart. Charge to 200. Victoria moved. She didn't think. Didn't hesitate. Her body reacted with muscle memory burned into her nervous system through hundreds of field emergencies where hesitation meant death. She grabbed a scalpel from the instrument tray, pushed past Dr. Patel, and made a single decisive incision between the patient's ribs. "What the fuck are you doing?" Reed screamed. Victoria's hands disappeared into the man's chest cavity. Blood poured over her gloves. She felt for the torn vessel, found it, clamped it with her fingers. Her other hand reached for forceps, grabbed them, secured the clamp. "I need a vascular tie. Now." Her voice was steady, clinical, completely devoid of emotion. Sandra stared at her in shock, then snapped out of it and slapped the surgical tie into Victoria's palm. Victoria worked fast, tying off the torn aorta with practiced precision. 30 seconds. The bleeding slowed. Stopped. "Suction," Victoria said. Another nurse obeyed automatically. The monitor beeped. Once, twice, a rhythm returned. Weak, but present. The patient's heart was beating again. Victoria stepped back. Her scrubs were soaked red from chest to waist. Her hands were steady. She set down the instruments carefully and looked at Dr. Reed. His face had gone from red to white. His mouth opened, closed. No sound came out. "He'll need a thoracic surgeon to finish the repair," Victoria said. "But he'll live long enough to get one now." The trauma bay door crashed open. Hospital security rushed in, followed by 2 uniformed police officers. "What's going on here?" The lead security guard looked around the blood-soaked room. "We got a call about an assault. She attacked my patient." Reed found his voice, pointing at Victoria with a shaking hand. "She performed surgery without authorization. She could have killed him." One of the police officers stepped forward. "Ma'am, I'm going to need you to step away from the patient." Victoria raised her hand slowly and walked backward until she hit the wall. The officer moved to her side, not touching her yet, but clearly ready to. "Dr. Reed saved his life," Sandra said quietly. Everyone turned to look at her. She swallowed hard, eyes darting between Reed and Victoria. Dr. Reed directed the procedure. Hayes was just following orders, right?" Reed stared at Sandra, at the other nurses, at his residents, all of them watching him, waiting to see what story he'd tell. "Right," Reed said finally. His voice was tight. "I directed the emergency thoracotomy. Hayes assisted. But she violated protocol by not waiting for my explicit verbal command. That kind of insubordination puts patients at risk." "He would have been dead," Victoria said flatly. "That's not your determination to make." Reed's composure cracked again. "You overstepped massively, Hayes. You're done here. Security, I want her badge. She's suspended pending disciplinary review, and I want a formal investigation into whether she should lose her nursing license permanently." The security guard looked uncomfortable. "Doc, if she saved the guy's life, she violated every protocol we have." Reed's voice echoed off the tile walls. "She could have caused catastrophic damage. The fact that it worked out doesn't excuse the breach. Now get her credentials and get her out of my emergency department." Victoria slowly unclipped her badge from her scrubs and handed it to the security guard. She didn't look at Reed. Didn't look at any of them. She walked toward the door with the police officer following close behind. Just before she stepped into the hallway, Dr. Patel spoke up. "Dr. Reed, the patient's family is going to want to know what happened. What do we tell them?" Reed ran a hand through his hair, his mind clearly racing through liability scenarios. "We tell them there were complications during resuscitation, but the patient is stable. Nothing about surgical interventions, nothing about irregularities. Understood?" Everyone nodded. Victoria walked out. The hallway felt colder than the trauma bay. Quieter. The sounds of the emergency department faded behind her as the security guard led her toward the administrative offices. Her scrubs were still wet with the federal officer's blood. Her hands were clean now. She'd washed them automatically before leaving. But she could still feel the warmth of his torn aorta between her fingers. She'd done the same procedure in a convoy outside Kabul while a machine gun rattled overhead and an 18-year-old private screamed for his mother. She'd done it in a field hospital with no power and no backup and no equipment except what she'd improvised from a broken truck's first aid kit. She'd done it 17 times, and 17 soldiers had lived when they should have died. But tonight, in a sterile American hospital with every resource available, she'd committed the unforgivable sin of making Dr. Marcus Reed look incompetent in front of his team. "Listen," the security guard said as they walked. His name tag read Morrison. "Off the record? You did the right thing. My cousin's a paramedic. He said that Fed was circling the drain when they brought him in. If you hadn't, it doesn't matter," Victoria said. "Sure it does. Reed's a politician. Everybody knows he cares more about his reputation than Morrison." She stopped walking and looked at him. "It doesn't matter. I violated protocol. Reed's within his rights to suspend me. That's how hospitals work." Morrison studied her face. "You're not even going to fight it?" "No." They reached the administrative offices. Morrison took her through the process of temporary suspension, paperwork, signatures, confiscation of her access cards. The whole thing took 15 minutes. Nobody met her eyes. The night administrator who processed the forms kept apologizing under her breath. When it was done, Victoria walked out through the emergency department's main entrance. The ambulances were gone. The trauma bays had been cleaned. Everything looked normal again, like nothing had happened. She stood in the parking lot under sodium lights turning the wet pavement orange. It was 3:30 in the morning, cold for April in Colorado. She pulled her jacket tighter and started walking toward her car. Her phone buzzed, a text from Trevor. "That was fucking incredible. Reed's shaking in his office. Everybody knows you saved that guy." She didn't respond. Another text. "Seriously, Hayes, what the hell? Where did you learn to do that?" She turned off her phone. Her car was a 15-year-old Honda Civic with rust eating the wheel wells. She got in, started the engine, sat in the dark listening to it idle. Her hands rested on the steering wheel. Still steady. Still calm. She'd been Captain Scarlett Hayes, United States Army, 31st Combat Support Hospital. She'd done 3 tours. Seen things that would have shattered most people. Earned a Bronze Star that she'd never told anyone about. Disappeared from military life after a classified operation went wrong, and she'd decided she was done with chains of command that valued politics over lives. She'd become Victoria Hayes, night shift nurse at Ridgemont Memorial. Nobody's hero. Nobody's threat. Just another middle-aged woman in cheap scrubs doing her job and keeping her head down. And now she'd blown it, because she couldn't watch someone die when she knew how to save them. Because 17 years of training and instinct and trauma had overridden common sense. Because some part of her still believed that saving lives mattered more than protecting egos. She put the car in reverse. The emergency department doors burst open behind her. Dr. Reed stormed out, phone pressed to his ear, gesturing angrily at someone on the other end. 3 black SUVs with tinted windows pulled into the ambulance bay. Men in tactical gear poured out. Not paramedics, not police. Military. Victoria's hands tightened on the wheel. More vehicles arrived. Armored trucks. Soldiers with rifles. They moved with precision toward the emergency department entrance. Reed dropped his phone mid-sentence and backed against the wall as they streamed past him without acknowledgement. This wasn't hospital security. This wasn't local law enforcement responding to the convoy attack. This was something else. Victoria watched through her rear-view mirror as a man in a colonel's uniform stepped out of the lead SUV. He spoke briefly with Reed, whose face went from angry to pale to terrified in the span of 10 seconds. The colonel gestured toward the trauma bays. Soldiers moved inside. Her phone buzzed again. She turned it back on. A number she didn't recognize. A text. "Captain Hayes, stay where you are. We're coming out." Her blood went cold. Nobody had called her captain in 6 years. Nobody in this city knew that name. She'd buried it deliberately, carefully, burning every bridge that connected her to the military world she'd left behind. The emergency department doors opened again. The colonel walked out, flanked by 2 armed soldiers. They moved directly toward her car. Victoria considered driving away, considered running, but her hand stayed frozen on the wheel because some instinct told her running would only make this worse. The colonel stopped beside her driver's side window and tapped on the glass. She rolled it down. He looked at her for a long moment, studying her face, her bloody scrubs, her exhausted eyes. Then he spoke quietly. "Captain Hayes, we need you to come back inside. The patient you saved is conscious, and he's asking for you by name." Victoria's stomach dropped. "I don't know any federal transport officers." "He knows you." The colonel's expression was unreadable. Says he served under your command in Kandahar. Says you saved his life twice before tonight." He paused. "He also says he's carrying classified intelligence that certain people at this hospital want buried, and that you're the only person he trusts to keep him alive long enough to deliver it." Somewhere in the building, an alarm started wailing. The colonel's radio crackled. A voice shouted, "Code Blue, Trauma 1, patient crashing again. Multiple cardiac arrests. We need—" The radio cut to static. Then gunfire. 3 sharp cracks echoing through the building's walls. The colonel's hand went to his sidearm. The soldiers raised their rifles. People started screaming inside the emergency department. And Victoria Hayes, the quiet nurse nobody respected, the invisible woman who'd spent 6 years trying to disappear, knew with absolute certainty that whatever she'd walked away from 6 years ago had just found her again. The colonel looked at her. "We can do this easy or hard, Captain, but you're coming back inside. Because right now, you're the only combat medic within 50 miles who knows how to keep that man breathing. And if he dies, a lot of powerful people are going to sleep better tonight." Victoria turned off her car engine. She opened the door and stepped out into the cold parking lot with her bloody scrubs and her steady hands and the weight of decisions she'd thought she'd left behind settling back onto her shoulders like ill-fitting armor. "Move," she said. They ran toward the screaming. The emergency department's automatic doors hissed open, and Victoria ran straight into chaos that smelled like gunpowder and panic. The fluorescent lights flickered. Someone had hit the fire alarm, and its shriek drowned out the screaming. Blood smeared the tile floor in streaks where people had slipped trying to run. 2 soldiers in full tactical gear stood at the entrance to Trauma 1 with rifles raised, blocking a knot of nurses and residents who were pressed against the far wall with their hands visible. Dr. Reed was shouting at a 3rd soldier, his face purple with rage. "You can't just storm in here with weapons. This is a hospital. I'm calling—" "But shut up." The soldier didn't even look at him. His eyes tracked Victoria as she moved past. "Colonel, subject entering the bay." The colonel, his name tag read Vance, strode ahead of Victoria and pushed open the trauma bay door. Inside was worse. Medical equipment had been shoved aside. The floor was covered in spent shell casings. 2 men in suits lay motionless near the supply cabinet, their bodies twisted at wrong angles, dark pools spreading beneath them. Victoria's brain cataloged it automatically. Exit wounds. Close range. Both dead before they hit the ground. The federal officer from earlier was still on the gurney, still alive, barely. His chest was open from Victoria's emergency procedure, hastily closed with temporary sutures that were already seeping. Someone had tried to disconnect his monitors. The IV line had been yanked out, blood dribbling from the puncture site. His eyes were half open, unfocused, his breathing shallow and wet. A 4th soldier stood beside the gurney with his sidearm drawn, pointed at the floor. His knuckles were white on the grip. "He coded twice," the soldier said without taking his eyes off the door. "Someone tried to unhook life support. We stopped them." The 2 in suits— Victoria moved to the gurney, already checking the officer's vitals. His pulse was thready, blood pressure critical. She didn't need a monitor to know he was minutes from complete cardiovascular collapse. "Federal marshals," Colonel Vance said, "according to their credentials. According to the patient, they were sent to finish what the highway ambush started." Victoria's hands moved on autopilot, reconnecting monitors, reestablishing IV access, checking the chest sutures. The officer's eyes tracked toward her, struggling to focus. His lips moved. No sound came out. She leaned closer. "Don't talk. Save your strength." His hand shot up and grabbed her wrist with surprising force. His mouth worked, desperate. She could see him fighting through shock and blood loss, and whatever sedatives they'd pumped into him. "Hayes," he whispered. His voice was shredded. "Captain Hayes. I don't go by that anymore." "Kandahar." Blood flecked his lips. "Convoy ambush. Route Jackson. You kept me breathing for 6 hours with a collapsed lung and no equipment. You told me I wasn't allowed to die because you had paperwork to finish." A horrible wet cough. "I believed you." Victoria stared at his face, the gray pallor, the scars along his jawline, and something clicked. A memory of dust and gunfire and a young private screaming while she shoved her fingers into his chest cavity to reinflate a punctured lung manually because the field kit was empty and the medevac was 3 hours out. "Carter?" The name came back. "Private James Carter." You were 19, man. 31 now. Another cough, weaker. Special Agent Carter. Homeland Security. His grip on her wrist tightened. They're going to kill me. The people who ordered the convoy hit. They've got someone inside this hospital, someone high up. That's why I asked for you. You're the only one I trust. Colonel Vance stepped closer. Agent Carter was transporting evidence from a federal investigation. Encrypted files linking defense contractors to illegal medical trials on veterans. The ambush was designed to look like random violence. It wasn't. Victoria kept working while they talked. New IV line, fresh bandages, adjusting oxygen flow. Her hands remembered the rhythm, even if her brain was still catching up to the nightmare she'd apparently walked back into. What medical trials? She asked. Carter's eyes closed, opened, closed again. Experimental combat enhancements, unauthorized drug trials. They used wounded vets as test subjects without consent, falsified medical records to cover the deaths. 3 hospitals, dozens of victims. Your hospital is one of them. The monitor beeped erratically. His pressure was dropping again. He needs surgery, Victoria said. The thoracic repair I did was temporary. He's got maybe 2 hours before internal bleeding kills him. You need a real surgeon, a real OR, and you need it now. Can you do it? Vance asked. I'm a nurse. I don't have surgical privileges. You performed emergency thoracic surgery 40 minutes ago. That was field medicine, battlefield triage. This needs precision work, proper anesthesia, a surgical team. Can you keep him alive long enough to testify? Victoria looked at Carter. His breathing was getting worse. His skin had gone translucent. She'd seen this before. The moment when a body decided it was done fighting. The quiet surrender that happened in the eyes before the monitors even registered it. Maybe, she said, if I have the right equipment and nobody tries to kill him again in the next 90 minutes. Vance nodded once. You'll have both. We're taking over this trauma bay, military jurisdiction under federal emergency powers. Anyone who objects can take it up with the Pentagon. He keyed his radio. Secure the floor, nobody in or out without my authorization, and find me whoever's in charge of this hospital. I want them here now. The door burst open. Dr. Reed pushed past the soldier trying to block him, his face a mask of indignation and fear. You can't commandeer my trauma bay. This is completely illegal. I'm calling our legal department and the police, and 2 federal marshals just tried to murder a protected witness in your hospital, Vance said calmly. Those marshals had access to patient records, security protocols, and internal communications. Someone gave them that access. So right now, Dr. Reed, everyone in this building is either a suspect or an accomplice until I determine otherwise. He gestured to the soldiers. Escort Dr. Reed to a secure room and keep him there. If he tries to make any phone calls, arrest him. Reed's eyes went huge. You can't. I'm the trauma director. I have patients. This is... You're done talking. Vance's voice dropped to something cold and final. Move. They hauled Reed out bodily. His protests echoed down the hallway until a door slammed and cut them off. Victoria was already elbow-deep in Carter's chest cavity again, palpating for new bleeding. She found it, a small tear near the original repair, seeping steadily. Not catastrophic yet, but it would be. I need a vascular surgeon, she said. Someone you trust absolutely. Someone who wasn't on staff here before tonight. Already on the way, military flight from Denver, ETA 30 minutes. Vance watched her work with an expression she couldn't read. You're very calm for someone who just walked into an assassination attempt. I've walked into worse. I read your file, Captain. I know what you've walked into. I also know why you left. He paused. For what it's worth, I think you got a raw deal. Victoria didn't respond. Her focus stayed locked on Carter's torn vessels and struggling heart. She could feel the muscles spasming under her fingers, trying to maintain rhythm against impossible odds. She'd felt this exact sensation 17 times before, 18 now. Each one left a permanent mark in her memory, the texture of human tissue fighting to survive, the warmth of blood that hadn't given up yet, the terrible intimacy of holding someone's life literally in your hands. Captain, Carter's voice was barely audible. The files. I uploaded them to a secure server before the ambush, but I kept one thing, physical evidence, in case the server was compromised. Where? He tried to reach for something under his torn shirt. Victoria stopped his hand gently and reached for him instead. Her fingers found a small waterproof pouch taped to his ribs, hidden under trauma pads. She pulled it free carefully. Inside was a USB drive sealed in plastic, and a photograph. The photograph showed a man in a hospital administrator's coat shaking hands with someone in military dress uniform. The background was clearly Ridgemont Memorial. She recognized the main lobby. The date stamp in the corner read 18 months ago. "Who is this?" Victoria held it where Carter could see. "Hospital COO." He coughed again, weaker. "Malcolm Brenner. He facilitated access to patient records, identified vulnerable veterans receiving treatment here, fed their information to the contractors running the trials." His eyes found hers. "He's still here, Captain. Still covering it up. Still identifying new victims." Victoria's jaw tightened. She'd seen Malcolm Brenner exactly twice in 6 years, both times during hospital-wide meetings, where he'd stood at a podium discussing efficiency metrics and cost reduction strategies. He'd had the kind of smooth confidence that came from never being questioned, the kind of polish that made people trust him automatically. "The USB?" she asked. Medical records, drug trial documentation, death certificates that were altered, and communications between Brenner and the defense contractors, enough to bring down everyone involved. Carter's breathing hitched. The monitor shrieked. "But they know I have it. That's why they hit the convoy, why they sent people here to finish me. If I die before this gets to the right hands, you're not dying tonight." Victoria adjusted medication dosages, checked suture integrity, made micro-corrections that bought him seconds at a time. "I didn't pull you out of Kandahar just to lose you in Colorado. You still owe me that paperwork." Something that might have been a smile crossed Carter's gray face. Then his eyes rolled back and the flatline alarm screamed again. Victoria slammed her fist into his chest once, twice, felt the heart stutter and catch. The rhythm returned, unsteady but present. She grabbed a syringe of epinephrine and pushed it directly into his heart muscle. His back arched. The monitor beeped frantically, then settled into something almost stable. Colonel Vance had pulled his sidearm at the sound of the alarm. Now he lowered it slowly. "How many times can you bring him back?" "As many as it takes." Victoria's voice was flat. "But we're burning time. Where's that surgeon?" 15 minutes out. "He might not have 15 minutes. Then make him have it." Vance moved to the door. "I'm going to find Malcolm Brenner. If he gets wind that Carter's still alive and talking, he'll disappear. Or he'll try to finish this himself." He looked back at Victoria. "Can you hold this bay alone?" She glanced at the soldier still standing guard. "I'll have help. His name's Corporal Hayes, no relation. He's a medic, but he takes orders from you now." Vance's expression softened slightly. "You were right to walk away 6 years ago, Captain. But tonight I'm glad you came back." He left before she could respond. The trauma bay fell quiet except for the rhythmic beeping of monitors and Carter's labored breathing. Corporal Hayes, a young black man with sharp eyes and steady hands, moved closer to the gurney. "Ma'am," his voice was respectful. "I read about you in training. The Kandahar siege. 72 hours under fire, keeping 11 soldiers alive. They use your case studies at Fort Sam, Houston." "They shouldn't." Victoria checked Carter's vitals again. Still critical, but stable for now. "I had help. A good team. And luck. The report said you amputated a leg with a Leatherman and a bottle of morphine, that you performed an emergency tracheotomy with a ballpoint pen. The report was classified." "Yes, ma'am." He smiled slightly. "Still required reading for combat medics, though, with the names redacted. Everyone knew it was you anyway." Victoria started to respond, but movement in the hallway cut her off. Through the small window in the door, she could see nurses and residents being herded past by soldiers. Dr. Reed's voice echoed from somewhere, still protesting. And then another voice, deeper, smoother, carrying the weight of institutional authority. "Malcolm Brenner. This is completely unacceptable. I'm the chief operating officer of this hospital. You can't just lock down an entire floor without proper authorization. I'm calling our board of directors and I'm calling the governor's office and..." Colonel Vance's voice cut through like a blade. "You're calling nobody, Mr. Brenner. You're coming with me to answer questions about your relationship with Redstone Defense Solutions and their unauthorized medical trials on federal property." Silence. Then, "I have no idea what you're talking about. We'll discuss it privately. Move." "I'm not going anywhere without legal representation. I know my rights. This is harassment. This is the sound of a safety clicking off. I strongly suggest you reconsider your priorities, Mr. Brenner. We can do this professionally or we can do it in handcuffs. Your choice. You have 3 seconds. Footsteps retreated. A door slammed. Victoria exhaled slowly. Corporal Hayes was watching her with an expression somewhere between awe and concern. You good, ma'am? Fine. She wasn't. Her hands were steady, but her mind was racing. 6 years. She'd spent 6 years building a quiet life where nobody knew who she was or what she'd done, where she could work her shifts and go home and sleep without dreaming about convoy ambushes and field hospitals and decisions that left people alive or dead based on seconds of judgment. And now it was all burning down because she'd made the same choice she always made. Save the life in front of her, consequences be damned. Carter stirred on the gurney. His eyes cracked open. Captain. Still here. Thank you. Blood on his teeth. For not leaving me. Thank me when you're testifying in a federal courtroom. She adjusted his oxygen mask. Until then, shut up and conserve energy. He almost laughed. Almost. Then his expression changed, fear cutting through the morphine haze. The files, the USB. You have to get it to someone you trust. Not military, not federal law enforcement. Too much corruption, too many people compromised. His hand found hers again, slick with blood. There's a journalist. Amanda Cross, investigative reporter for the Denver Times. She's been trying to break this story for 2 years. If anything happens to me, nothing's happening to you. If it does, his grip tightened. Promise me, the evidence gets out. These people don't get to cover this up again. Victoria looked at the USB drive sitting on the instrument tray. A small piece of plastic and silicon that apparently contained enough information to destroy careers and send people to prison. Worth killing for. Worth dying for. I promise, she said quietly. The trauma bay door opened. A woman in surgical scrubs strode in. 50s, gray hair, the kind of calm competence that came from decades in operating rooms. A major's insignia on her collar. Captain Hayes? She moved directly to Carter, assessing him with quick professional eyes. I'm Major Simmons, thoracic surgery. I hear you've been keeping this man alive through sheer stubbornness. Someone had to. Simmons smiled grimly. Let's see what we're working with. She pulled on gloves and began examining Victoria's emergency repairs. Her expression shifted from clinical assessment to something close to surprise. You did this in an emergency room? Without surgical support? Yes, ma'am. Your suturing is immaculate. The vessel repair is textbook. If I'd done this myself in a proper OR, I couldn't have done it cleaner. Simmons looked up. You said you're a nurse? I was a combat medic. Nurse now. You're wasted in an emergency department. Simmons continued her examination, probing gently around the torn vessels. This man should be dead 5 times over. The fact that he's not is because of your intervention. Both times. She straightened. All right, here's what's going to happen. We're setting up a temporary operating room in the adjacent bay. Full surgical suite, portable equipment. I need you to assist me. I'm not qualified for You're the most qualified person in this building for what we're about to do. You know battlefield repairs. You know how to keep people alive in suboptimal conditions. That's exactly what this is going to be. Suboptimal and dangerous and improvised. So yes, Captain, you're assisting. Unless you have objections? Victoria looked at Carter. His eyes were closed, but his chest rose and fell in shallow, steady rhythm. Still fighting. No objections, ma'am. Good. Corporal, help me move this equipment. Captain, prep the patient. We're moving in 5 minutes. They worked fast. The adjacent trauma bay was transformed into a makeshift operating room. Surgical lights rigged to ceiling mounts. Equipment wheeled in from storage. Sterile fields established with military efficiency. Victoria prepped Carter for transport, keeping his vitals stable through sheer force of will and precisely timed medication adjustments. Dr. Reed appeared in the doorway as they were moving the gurney. 2 soldiers flanked him, clearly his escorts rather than his support. His face was blotchy, his expensive coat wrinkled. He looked like a man whose world had collapsed in the span of an hour. Hayes, his voice cracked. What the hell have you done? Do you have any idea what this means for the hospital? For all of us? The military is threatening to shut us down. They're talking about federal investigations, criminal charges. They're saying—" He stopped, swallowed hard. "They're saying I was negligent, that I delayed treatment to let a federal witness die." Victoria stopped the gurney, looked at him. "Were you?" "What? No, I'm a doctor, not a—" But his eyes slid away. Couldn't hold her gaze. "I made medical decisions based on the information available. I didn't know he was carrying classified evidence. I didn't know there was a conspiracy. I just— You wanted me gone." Victoria's voice was quiet, deadly calm. "You've wanted me gone for 6 years. The incompetent old nurse who made you look bad. So when I told you his aorta was torn, you dismissed it. Not because you thought I was wrong, because you couldn't stand the idea that I might be right." Reed's face went crimson. "That's not— You can't prove—" "I don't have to prove anything. The federal investigators will handle that." She started moving the gurney again. "Get out of my way, doctor." He didn't move. Just stood there in the doorway, blocking their path, his expression cycling through rage and fear, and something that might have been genuine confusion. "I could have died tonight," he said finally. "Those fake marshals. When they started shooting, I was standing right there. I could have—" His voice broke. "I'm not part of this. Whatever Brenner did, whatever conspiracy you're talking about, I didn't know. You have to believe me." Victoria studied his face, saw the fear there, the desperate need to be believed, and she realized he was probably telling the truth. Reed was arrogant and petty and dangerous in his own way, but he wasn't a killer. Just a small man who'd let his ego make him complicit in something much bigger than he understood. "Then cooperate with the investigation," she said. "Tell them everything you know about patient admissions, about how veterans were selected for treatment here, about any unusual directives from Brenner's office. And maybe you walk away from this with just a damaged career instead of a prison sentence." She pushed past him. The gurney rolled into the makeshift OR. The door swung shut in Reed's face. Major Simmons was already scrubbing in, calling out orders to Corporal Hayes and 2 other military medical personnel who'd arrived with equipment. The room hummed with organized chaos, the good kind, where everyone knew their role and moved with synchronized precision. "Captain, scrub in. We're starting in 90 seconds. Simmons didn't look up from her preparations. "Fair warning, this is going to be complicated. His chest cavity is a mess. Multiple vessel tears, tissue damage, possible complications from the earlier trauma. We're going to be working fast in tight spaces with minimal margin for error." Victoria scrubbed her hands methodically, watching Carter through the observation window. His face was obscured by oxygen equipment now, his body draped in sterile fields. He looked small on the table, vulnerable. Nothing like the tough federal agent who'd survived an ambush and 2 assassination attempts in one night. She thought about Private James Carter at 19 screaming in the back of a damaged convoy truck, while she dug shrapnel out of his chest with her bare hands and told him to shut up and live. She'd been younger then, angrier, still believing that competence and courage mattered more than politics. The military had taught her otherwise, officially commended her for valor, unofficially buried her after she'd testified about command failures that got 3 soldiers killed, made it clear that telling inconvenient truths was more dangerous than any enemy fire. So she'd walked away, changed her name legally, moved to a city where nobody knew her, became someone who took orders instead of giving them. And somehow she'd ended up right back here, hands inside someone's chest, making life or death decisions, surrounded by people with guns and secrets. "Captain?" Major Simmons stood at the table, gloved and ready. "We're starting. I need you focused." Victoria moved to the table, took her position. Her hands settled into familiar patterns, anticipating instruments, maintaining exposure, keeping tissue viable while Simmons worked. The surgery took 90 minutes, no complications, no setbacks, just meticulous precision in the hands of 2 women who'd learned their craft in places where mistakes meant body bags. Carter's vitals stabilized gradually, blood pressure rising, heart rhythm strengthening, breathing steadier. When Simmons finally closed the chest cavity and stepped back, Victoria realized her shoulders were screaming and her back felt like someone had driven nails into her spine. She'd been standing perfectly still, holding retractors in place for almost an hour without moving. "He'll live." Simmons pulled off her gloves. "Barring infection or complications, he should make a full recovery. Well done, Captain." "You did the hard part, ma'am." "We both did." Simmons turned to face her fully. I'm going to recommend you for reinstatement, full rank restoration, medical course. We need people like you, people who know. Victoria's voice was flat, final. Thank you, but no. Captain, I'm not captain anymore. I haven't been for 6 years, and I'm not going back. Simmons studied her for a long moment, then nodded slowly. Understood. For what it's worth, I think that's a waste of exceptional talent, but I respect the choice. They moved Carter to recovery, set up monitoring equipment, posted guards. Corporal Hayes volunteered for first watch, settling into a chair beside the gurney with his rifle across his lap and his eyes alert. Victoria walked out into the hallway and found chaos of a different kind. The emergency department had been completely locked down. Soldiers at every entrance, staff confined to break rooms under guard, patients diverted to other hospitals. The entire building felt like a military installation now instead of a civilian medical center. Colonel Vance stood near the nurses' station with Malcolm Brenner in handcuffs. The hospital's COO had lost his smooth confidence. His expensive suit was rumpled. His face was pale and slick with sweat. Behind them stood a woman Victoria vaguely recognized, someone from hospital administration, younger, her eyes red from crying. I want a lawyer, Brenner was saying. I'm not answering any more questions without legal representation. This is harassment. This is a federal investigation into conspiracy to commit murder, medical fraud, and violations of the Nuremberg Code, Vance said calmly. You're going to answer questions, Mr. Brenner. The only variable is whether you cooperate now and possibly receive consideration for your cooperation, or whether you stay silent and face the maximum penalties allowed by law. He nodded to the soldiers. Take him to the conference room. Keep him comfortable but isolated. No phone calls. No contact with anyone. They hauled Brenner away. His protests faded down the corridor. The woman from administration looked at Victoria. Her nameplate read, Jennifer Caldwell, Assistant Administrator. Is Agent Carter going to survive? Yes. Thank God. Caldwell's voice shook. I didn't know about any of it. Malcolm handled all the veteran admissions personally, said it was a special program, that we were helping people. I just processed paperwork. I didn't... She stopped, tears streaming. How many? How many people died because I didn't ask questions? Victoria had no answer for that, didn't even try to find one. She just looked at this young administrator who'd trusted the wrong person and processed paperwork that facilitated murder and felt nothing but tired. Colonel Vance dismissed Caldwell with instructions to make herself available for questioning. When she was gone, he turned to Victoria. You look like hell, Captain. I've looked worse. She leaned against the wall, suddenly aware of how exhausted she was. Her scrubs were still crusted with blood, Carter's, the fake Marshall's, her own from a cut she didn't remember getting. What happens now? Now we secure the scene, collect evidence, and begin formal proceedings against everyone involved. Vance pulled out his phone, showed her a photo. We found this in Brenner's office. Recognize it? The photo showed a document, medical trial protocols for something called Project Sentinel. Experimental combat enhancement drugs tested on wounded veterans without informed consent. 3 test sites listed: Ridgemont Memorial in Colorado, Northern Cross Hospital in Michigan, St. Catherine's Medical Center in Georgia. And at the bottom a list of names: doctors, administrators, defense contractors, all participants in a conspiracy that had apparently been running for 3 years. Dr. Marcus Reed's name wasn't on the list, but Victoria saw other names she recognized, nurses she worked with, physicians she'd respected, people who'd apparently looked at wounded veterans and seen test subjects instead of patients. Jesus, she whispered. 43 victims identified so far, Vance said quietly. Most died during the trials. Their deaths were attributed to complications from their service-related injuries. Families were told their loved ones' sacrifices helped advance military medicine. It was all lies. Victoria's hands clenched into fists. She'd spent 6 years in this hospital, 6 years walking past these people, taking their orders, keeping her head down. And the entire time they'd been murdering veterans in the rooms right next to where she worked. I want to help. The words came out before she'd consciously decided to say them. The investigation, whatever you need, I want these people buried. Vance nodded. I was hoping you'd say that, because there's a problem. He glanced around, lowered his voice. The evidence Carter was carrying? It's comprehensive, but not complete. We need witness testimony, medical records from inside the hospital's system, proof of how patients were selected and who gave the orders, someone with access to internal files and the medical knowledge to understand what they're looking at. You want me to go through hospital records? I want you to find the victims' files, reconstruct what was done to them, build a case that can't be dismissed or buried by expensive defense attorneys. He paused. It means staying here, working with federal investigators, potentially testifying in multiple trials over the next year. Your quiet life is over, Captain. Are you willing to accept that? Victoria thought about Private James Carter at 19, thought about 43 other veterans who'd trusted the system to heal them and been betrayed, thought about 6 years of keeping her head down while people died in the next room. Yes, she said. Movement at the emergency department entrance caught her eye. Through the glass doors, she could see news vans pulling into the parking lot, cameras, reporters. The story was already leaking. By tomorrow morning, every news outlet in the country would be covering this. And somewhere in the crowd of reporters, a woman with dark hair and a notepad was arguing with the soldiers at the perimeter. Victoria recognized her from the photo Carter had shown her, Amanda Cross, the journalist who'd been investigating this story for 2 years. I need to talk to her, Victoria said, pointing. The reporter. Carter wanted his evidence to reach her if something happened to him. Vance frowned. We can't have civilian reporters interfering with... Carter doesn't trust the military, doesn't trust federal law enforcement. He survived 2 assassination attempts tonight because corrupt people in positions of power wanted him dead. So if he says this journalist is trustworthy, I believe him. Victoria started walking toward the entrance. And I'm giving her the USB drive Carter died protecting. He's not dead. But he almost was. Multiple times. Because people like Brenner decided covering up their crimes was more important than human life. She stopped at the doors, looked back. You want justice, Colonel? Real justice? Then we need more than federal investigations that can be buried or classified. We need public exposure. We need people so angry that no amount of political pressure can make this go away. That's what reporters do. Vance stared at her for a long moment. Then he pulled his radio. Let the journalist through, the one arguing with Sergeant Miller. Escort her to the conference room. Captain Hayes will meet her there. Victoria nodded once and headed toward the conference room. Her body felt like it weighed 1,000 pounds. Her hands hurt. Her back hurt. Her head hurt from stress and exhaustion and the weight of decisions she hadn't wanted to make. But she kept walking. Because 43 veterans had died without anyone fighting for them. And Private James Carter, Special Agent James Carter, had nearly become number 44. Not tonight, not on her watch. The conference room was small, windowless, still smelling like stale coffee and desperation. Victoria sat down at the table and waited. The USB drive felt heavy in her pocket. A small piece of plastic containing evidence that would destroy careers and end lives and burn down everything Brenner and his co-conspirators had built. The door opened. Amanda Cross walked in, flanked by a soldier who took up position outside. She was younger than Victoria expected, maybe 35, sharp eyes, ink stains on her fingers from note-taking. She carried a worn leather bag and the kind of exhausted determination that came from chasing stories nobody wanted told. You're the nurse, Amanda said. Not a question. The one who saved the federal agent, Captain Hayes. Just Hayes. Victoria pulled out the USB drive and set it on the table between them. Agent Carter wanted you to have this. Evidence from a federal investigation into illegal medical trials on veterans. 3 hospitals, 43 victims, defense contractors, hospital administrators, and government officials all involved. Amanda stared at the drive like it might explode. Carter's alive? Yes. Barely. He was ambushed tonight because people wanted this evidence buried. They failed. Victoria stood. It's yours now. Do whatever you need to do with it. Just make sure it can't be buried again. Wait. Amanda grabbed her arm. I need context, background. Someone who can explain the medical aspects and testify about what happened inside the hospital. Will you? Yes. Victoria pulled her arm free gently. I'll testify. I'll help you understand the files. I'll do whatever it takes to make sure this story gets told completely and accurately. She moved toward the door. But right now, I need to check on my patient, and you need to get that drive somewhere secure before someone realizes you have it. Amanda nodded slowly, already pulling out her phone. Thank you for trusting me with this. Victoria almost laughed. Trust had nothing to do with it. Carter had asked her to do this, and she'd made a promise. Simple as that. She walked out into the hallway and found Major Simmons waiting for her. Captain, Agent Carter is awake, asking for you. They walked to recovery together. Carter was propped up slightly, oxygen mask removed, his color better than it had been in hours. He looked like hell, but he was conscious and breathing on his own and alive. Captain, his voice was rough but clear. I heard you gave the files to Cross. You told me to. I did. Thank you. He coughed, winced. They're going to come after you now. When the story breaks, when the trials start, defense attorneys will tear your credibility apart. Federal prosecutors will demand you cooperate fully. The media will dig into your past. Your quiet life? It's gone. I know. And you're okay with that? Victoria thought about it, really thought about it. About 6 years of invisibility and safety and keeping her head down. About Dr. Reed's condescension and the hospital politics and the exhausting effort of pretending to be less than she was. About 43 dead veterans and the system that had failed them. No, she said honestly. I'm not okay with it, but I'll deal with it anyway. Carter smiled weakly. That's the Captain Hayes I remember, stubborn as hell. His expression sobered. One more thing. Brenner's not the top of this. He's middle management. Whoever organized these trials, whoever gave the orders, they're still out there, still protected, still dangerous. Do you know who? I have suspicions, names, but no proof yet. His eyes met hers. Watch your back, Captain. This isn't over. Before Victoria could respond, alarms started blaring throughout the building. Emergency lockdown protocols, soldiers shouting, running footsteps in multiple directions. Colonel Vance burst into the recovery room, weapon drawn. We've got a breach. Someone just tried to access the hospital's main server room. Security footage shows 2 individuals in military uniforms. They're inside the building, armed. Victoria's blood went cold. They're after the patient records. The evidence file's still in the hospital system. Or they're after Carter. Vance keyed his radio. All units code black. Armed hostiles in the building. Protect the witness. Shoot to kill if necessary. More gunfire. Closer now, coming from the direction of the administrative wing. Screaming. The distinctive crack of rifles in enclosed spaces. Corporal Hayes stood at the door, rifle raised, eyes locked on the hallway. Ma'am, we need to move the patient. This room's not defensible. Where? Victoria looked around. They were on the 2nd floor, surrounded by glass and drywall. Nowhere to hide. Nowhere to run. The basement, Major Simmons said. Old surgical wing. It was decommissioned 5 years ago, but the rooms are solid concrete. Reinforced. Used to be a fallout shelter during the Cold War. If we can get him down there. Do it. Vance was already moving. Take Hayes and 2 others. I'll hold this floor. They moved fast, wheeling Carter's gurney toward the service elevator while gunfire echoed through the building like thunder. Victoria's hand stayed on the IV lines, keeping them stable, watching Carter's vitals even as chaos erupted around them. The elevator doors opened. They shoved the gurney inside. Major Simmons hit the basement button. The doors started to close, and Victoria saw them. 2 figures in tactical gear rounding the corner at the end of the hallway. Not soldiers. Wrong equipment. Wrong movement patterns. They raised their weapons. Colonel Vance threw himself in front of the elevator. Get down! The doors closed. The elevator dropped. Above them, the sound of sustained gunfire turned the ceiling into thunder. Carter grabbed Victoria's hand. They're going to kill everyone up there looking for me. Then we make sure you survive long enough to make it worth something. Victoria checked his vitals. Still stable. Still fighting. You're not dying tonight, Agent. I already told you that. The elevator hit the basement with a jolt. The doors opened onto darkness and the smell of old concrete in disuse. Emergency lighting cast everything in sickly yellow. Corporal Hayes moved out first, rifle sweeping the corridor. Clear. They rolled Carter into the old surgical wing, found a room with reinforced walls and a single entrance, barricaded the door with equipment, set up monitoring in the corner, dimmed the lights to almost nothing, and waited. Somewhere above them, the battle for Ridgemont Memorial Hospital continued. Victoria sat beside Carter's gurney in the dark, listening to the distant sounds of violence, and realized her quiet life hadn't just ended tonight. It had burned completely to the ground, and standing in the ashes was the person she'd tried so hard to stop being, Captain Scarlett Hayes, combat medic, the woman who couldn't walk away from fights she should have avoided. Carter's breathing was steady in the darkness. His vitals held. He was going to live. But Victoria had the distinct feeling that before this was over, she was going to wish he'd asked for somebody else. The radio on Corporal Hayes' belt crackled with static. Then Colonel Vance's voice came through, tight with strain. Hostiles neutralized, building secure. But we've got a problem. The server room was accessed. Patient files were downloaded to an external device before we stopped them. Someone just got a complete list of everyone who cooperated with the investigation. Every witness, every source, The transmission cut to screaming static. Then silence. Carter's eyes opened in the darkness, finding Victoria's face. They have your name now. Everyone who helped tonight. They know exactly who to target. The lights in the basement flickered. Once, twice. Went out completely. And in the sudden pitch black, Victoria heard the sound of footsteps in the corridor outside, moving with the patient precision of people who hunted for a living. Corporal Hayes killed the monitor lights with one hand, while his other brought the rifle to his shoulder in absolute silence. Victoria's palm found Carter's chest, pressing down gently, a signal to stay still, stay quiet. The footsteps in the corridor moved with deliberate slowness, heel-toe placement that minimized sound. Professional. Not hospital security stumbling around in the dark. Not panicked staff looking for shelter. Hunters. The emergency lighting had died with the main power, leaving only the faint glow of battery backup that barely illuminated the cracks under the doorway. Victoria's eyes adjusted slowly. She could make out shapes now. The barricaded door, medical equipment stacked against it. Major Simmons crouched near the far wall with a scalpel gripped like a weapon, because surgeons didn't carry guns. Carter's breathing changed. Faster, shallower. Victoria felt his heart rate climbing under her palm, stress response, adrenaline overriding sedatives, his body preparing for fight or flight, despite the chest full of fresh sutures. She leaned close to his ear. Control your breathing. In through your nose, 4 counts. Hold. Out through your mouth, 4 counts. Her whisper was barely audible. You tear those sutures and you bleed out in 90 seconds. Stay calm. His hand found hers in the darkness. Squeezed once. Message received. The footsteps stopped outside their door. Silence stretched. Victoria counted her own heartbeats. 12, 15, 20. Nothing moved in the corridor. No sound except the distant drip of water from old pipes and the faint electrical hum of Carter's portable monitor running on battery backup. Then a voice came through the door. Male, conversational. We know you're in there. Federal agent, military medical personnel, and one very impressive nurse who should have stayed retired. A pause. We're not here to kill anyone unnecessarily. We just need Agent Carter and whatever evidence he's still carrying. Hand him over and the rest of you walk away. Simple transaction. Corporal Hayes' finger rested on the trigger guard. He looked at Victoria. She shook her head slightly. Talking meant revealing exact positions, meant giving them tactical information. The moment anyone in this room spoke, bullets would start tracking sound. Not interested in negotiating? The voice continued, still calm. That's unfortunate. See, we've already secured the upper floors. Your Colonel Vance is dead. The soldiers guarding the main entrance are dead. The reporter who thought she was protecting evidence? Also dead, along with her USB drive that's currently melting in a microwave 3 floors up. Another pause. You're alone down here. No backup coming. No rescue. Just you and us and time running out. Victoria's jaw clenched. Amanda Cross dead. Vance dead. The evidence destroyed. She didn't know if it was true or psychological warfare, but it didn't matter. True or not, they were still trapped in a concrete room with a critically wounded patient and limited options. Last chance, the voice said. Open the door. Hand over Carter. Everyone else lives. We'll even let you keep playing nurse somewhere far away from this mess. Or we breach this room, kill everyone inside, and take what we came for anyway. You've got 30 seconds to decide. Carter's grip on Victoria's hand tightened. She felt him trying to sit up, trying to speak. She pressed him back down, her other hand covering his mouth. Not gently. "Don't," she breathed directly into his ear. "Don't you dare." His eyes found hers in the darkness. She could see the resignation there, the soldier's calculus that said one life traded for 3 was good math. She'd seen that look before, on young privates who'd tried to draw enemy fire away from their units, on wounded men who'd begged to be left behind so the others could move faster. She'd never let them make that trade. Wasn't starting now. "Time's up," the voice said. The door exploded inward. Not breached, blown. Shape charge placed at the hinges, precisely detonated. The barricaded equipment flew backward in a shower of sparks and twisted metal. Smoke filled the room. Victoria threw herself over Carter's gurney as shrapnel tore through the space where she'd been standing. Muzzle flash in the doorway. Corporal Hayes fired 3 rounds, shifted position, fired again. Someone screamed. Hayes dropped behind an overturned crash cart as return fire chewed through the metal, punching holes that let emergency light stream through like 6 spotlights. "Suppressing," Hayes shouted, popping up to fire in controlled bursts. Victoria's ears rang from the concussion. She did a frantic mental inventory. Was she hit? She didn't think so. Carter? His gurney had shields meant for radiation protection, dense enough to stop small arms fire. Probably. She couldn't see blood spreading under him. Major Simmons was moving, combat crawling toward the door with her scalpel still gripped tight, which meant she wasn't hit either, or she was running on adrenaline and didn't know it yet. 2 figures rushed the room through the smoke. Hayes caught the first one center mass, 3 rounds that dropped him instantly. The second one made it inside, rifle sweeping. Major Simmons rose from the floor like a ghost and buried her scalpel in the base of his skull. Perfect anatomical precision. He collapsed without firing a shot. "Reloading." Hayes ejected his magazine, slammed in a fresh one. More movement in the corridor. Flashlight beams cutting through smoke. At least 3 more hostiles, maybe 4. Victoria looked around desperately for anything useful. Medical supplies. IV poles. A defibrillator that would make a decent club but wasn't going to stop bullets. Her hand closed on Carter's tactical vest, still piled in the corner where they'd cut it off him earlier. She pulled it close, felt through the pockets. Empty. 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 Then her fingers found something hard and rectangular strapped to the inside panel. A backup service weapon. Glock 19. She pulled it free, checked the chamber. Loaded. 15 rounds. "Hayes!" She tossed it toward Corporal Hayes. He caught it one-handed without looking, transitioned to dual weapons. "Simmons, get behind the gurney with Carter. Stay low." The major moved fast, dragging herself across the floor. Victoria positioned herself at Carter's head, hands on the gurney handles, ready to move him if an exit appeared. Not that there was anywhere to go. 1 door, 1 corridor. And that corridor was currently filling with people who wanted them dead. Flashlight beam hit Victoria square in the face, blinding. She turned away, spots dancing in her vision. A voice from the doorway, different from before, younger, stressed. "Targets acquired, permission to—" "Negative," the first voice cut in. "Carter alive. Medical personnel expendable. Controlled fire." The distinction was tactical. They needed Carter breathing long enough to extract information about where else evidence might be hidden. Everyone else was just obstacles. Hayes and the hostile in the doorway fired simultaneously. Hayes was faster and more accurate. The hostile went down. But more were coming. Victoria could hear them staging in the corridor, coordinating movements, preparing for an organized breach that would overwhelm the room's single defender through sheer numbers and firepower. "We can't hold this position," Hayes said, voice tight. "Ma'am, we need to fall back." "Fall back where?" "There's 1 door." "Then we make another one." He pointed to the far wall. Old ventilation shaft. Big enough to fit a person. Maybe big enough for a gurney if we angle it right. Victoria looked, saw the rusted grate he was talking about 3 feet off the floor. It looked like it hadn't been opened in decades. "That leads where?" "Don't know. Anywhere's better than here." He was right. They were about to be overrun in seconds. Victoria grabbed the gurney, started wheeling it toward the wall. Major Simmons was already at the grate, prying at it with her scalpel. The screws were rusted solid. "Harder," Victoria said. Simmons braced her foot against the wall and pulled. The grate shrieked, metal on metal. 1 corner came free. Then another. She wrenched it completely off and threw it aside. The opening was maybe 30 inches square. pitch black inside. Carter goes first, Victoria said. Then Simmons. Then, "Ma'am, I'm staying." Corporal Hayes was at the door, firing in short, controlled bursts. "Someone needs to slow them down, buy you time." "Negative. We all go." "There's no time. And you can't protect that patient and fight. I can." He glanced back, and Victoria saw he was maybe 23 years old, barely older than the soldiers she'd tried to save in Kandahar. "You taught us that in training, ma'am. Mission first. Get Carter somewhere safe. That's what matters." More gunfire from the corridor. Closer. Hayes took a round to his vest that knocked him backward. He grunted, stayed on his feet, kept firing. "Go!" he shouted. Victoria wanted to argue, wanted to refuse, wanted to find some brilliant third option where everyone lived. But combat medicine had taught her brutal triage. Sometimes you couldn't save everyone, and choosing who to save was part of the job. She grabbed Carter under the shoulders. "Simmons, his legs. Lift on 3. They heaved him off the gurney and toward the shaft opening. Carter bit down on a scream as fresh sutures pulled. Victoria saw blood seeping through his bandages, but couldn't stop to check how bad. They fed him into the shaft feet first, his body barely fitting through the opening. "There's a drop," Carter gasped. "Maybe 4 feet, then it levels out." Simmons went next, disappearing into darkness. Victoria grabbed the portable monitor, the IV bag, a trauma kit, threw them into the shaft after Simmons. Behind her, Hayes was firing steadily, making every round count. "Hayes, I know, ma'am." His voice was calm, accepting. "Get Carter out. Make this mean something." Victoria climbed into the shaft. The space was suffocating, barely wide enough for her shoulders. Old ventilation ductwork that smelled like mold and rust and decades of accumulated filth. She could hear Simmons ahead, dragging Carter forward with grunting effort. Could hear Hayes behind, still firing, then a magazine change, then silence. Then an explosion that shook the walls and filled the shaft with heat and pressure. Grenade. They'd fragged the room. Victoria crawled faster, the shaft angled downward, forcing her onto her stomach, pulling herself forward with her elbows while her legs kicked for purchase on smooth metal. She could hear Carter ahead, his breathing ragged, could hear Simmons coaching him through the pain. The shaft opened into a wider space, some kind of junction point where multiple ventilation paths converged. Emergency lighting here, faint but present. Victoria pulled herself out and immediately checked Carter. His bandages were soaked through, pressure dropping. He was going into shock from the movement and stress. "We need to stop," Simmons said. "Stabilize him. He's bleeding internally again." "We can't stop. They'll track us through the shaft." "If we don't stop, he dies anyway." Victoria looked at Carter's gray face, saw his eyes losing focus. Simmons was right. They'd just undone 2 hours of surgical repair dragging him through a ventilation shaft. His chest cavity was probably filling with blood again. She pulled supplies from the trauma kit, started an emergency transfusion using bags she'd grabbed from the room, pushed medications that would buy time but weren't solutions, applied pressure to visible bleeding while Simmons worked on checking vitals. "Talk to me," Victoria said. "Carter, stay with me." His eyes found hers. "Did Hayes make it?" "I don't know. The files, the evidence. If Cross is really dead, then we find another way." Victoria's hands moved automatically, adjusting IVs, checking pulses. "You're alive. You can still testify. That's what matters." "Not enough." He coughed blood. "Brenner's just middle management. The person who organized these trials, who gave the orders. They're still protected, still free, unless we can prove—" Footsteps echoed from somewhere in the ventilation system. Flashlight beams bounced off metal walls, voices calling out coordinates, directing search teams. "They're in the ducts," someone shouted. "Seal all exits. I want them trapped." Victoria looked around. The junction had 4 branching shafts, no indicators of where any of them led. Pick wrong, and they'd crawl into a dead end. Pick right, and they might find a way out. 50-50 odds at best. "That one," Carter pointed to the shaft on the left. His hand was shaking. "Goes toward the loading dock. Old freight elevator shaft nearby. It's not on modern blueprints, but it's there. Used it during site inspection 6 months ago when I was investigating this place undercover." "You were here before?" "For 3 months. Worked as a medical supply courier, had access to storage areas, patient records, shipping manifests. That's how I built the case. He coughed again, weaker. The freight elevator. If we can reach it, there's emergency exit stairs that connect to the parking structure. Way out. Victoria and Simmons grabbed him under the shoulders and started dragging him toward the left shaft. Moving him was agony. His body weight pulled at their arms, their backs, their already exhausted muscles. The shaft was barely 4 feet high, forcing them to crouch walk while carrying a full-grown man between them. Behind them, flashlight beams grew brighter. The search teams were getting closer. They moved for what felt like hours, but was probably 5 minutes. The shaft ended at a junction with rusted steel doors that opened onto a narrow maintenance corridor. Ancient fluorescent lights buzzed overhead, half of them dead. The corridor stretched in both directions, identical concrete walls with no identifying marks. "Which way?" Simmons gasped. Carter's eyes were closed, not responding. Victoria checked his pulse. Still there, but weakening. They were losing him. She picked a direction based on nothing but instinct and started moving. The corridor branched twice. She took the right branch because the left smelled like standing water and blocked passages. Came to a junction with 3 choices and nearly screamed in frustration. Then she heard it, distant but distinct. The mechanical hum of an elevator shaft. They followed the sound. Came to a service area with old loading equipment and a freight elevator that looked like it hadn't been used since the hospital was built. The cage door was partially open. Inside, the elevator car sat at an angle, one corner sagging where the cable had stretched or frayed. "That's not safe," Simmons said. "Neither is staying here." Victoria pulled the cage door fully open. Metal shrieked. She stepped into the car carefully, felt it shift under her weight. The cable groaned. "It'll hold, probably." They dragged Carter inside. The car dipped another inch and stopped. Victoria found the control panel, ancient buttons, half of them missing. Only 2 still worked. Up and down. She pressed up. Nothing happened. Pressed it again. Still nothing. Manual override. Carter's eyes opened slightly. His hand moved weakly toward a panel on the wall. Breaker box. Flip the main switch. Victoria found it. Rusted metal box with a lever. She threw it hard. Something deep in the shaft clanked. The elevator shuddered. The motor engaged with a grinding noise that sounded like metal eating metal. Then they started rising, slowly, maybe 6 inches per second. The entire car shaking, swaying on damaged cables. Through the gaps in the shaft wall, Victoria could see maintenance levels passing. Sub-basement 3, sub-basement 2, sub-basement 1. "They'll see us," Simmons said. "The moment we reach ground level, they'll be waiting." "I know." Victoria checked Carter's vitals again, barely conscious, still bleeding. Maybe 20 minutes left before he crashed completely. But we're out of options. The elevator passed ground level without stopping. She'd pushed the wrong button. It was going to the top floor. She reached for the controls, but Carter grabbed her wrist. "No, let it go up. Roof access, helicopter pad. If we can signal for help." "With what?" "We don't have a radio. We don't have anything." "Fire." He pointed at the trauma kit. "Medical alcohol gauze. Make smoke. Someone will see." The elevator groaned past the 2nd floor. 3rd floor. The motor was screaming now, grinding itself apart. 4th floor, 5th. The cable made a sharp twanging sound, and the car dropped 6 inches before catching again. Simmons grabbed the wall. "This thing's going to fall." "Not yet, it's not." Victoria pulled supplies from the trauma kit, medical alcohol in small bottles, rolls of gauze, a disposable lighter someone had left in the kit for sterilizing instruments in field conditions. She started soaking gauze with alcohol. "When we hit the roof, we run. Make signal fires. Someone has to see. Police, news helicopters, anyone." 6th floor. The motor pitch changed, grinding slower. The car lurched, dropped another foot, caught. Held. "We're not going to make it," Simmons said quietly. "Yes, we are." Victoria didn't believe it, but said it anyway. 7th floor. The cable made a popping sound, individual strands separating, 8th floor. The car was barely moving now, the motor whining in mechanical death throes, 9th floor. They should have hit the roof by now. The elevator was moving, but they were in darkness, like the shaft extended higher than the building's normal height. Then the car stopped. Not at a floor, just stopped, hanging in the shaft with the motor still grinding but no movement. We're stuck, Simmons said. Victoria looked up through the car's ceiling grate, saw the cable about 4 feet above them, frayed and twisted. Saw the shaft opening to what looked like the roof access maybe 10 feet higher. Close enough to see moonlight, too far to reach. She grabbed the ceiling grate and pulled. It came free easier than expected, rusted through. She looked at Simmons. Can you climb? With what? There's nothing to hold on to. Victoria studied the shaft. Bare concrete walls, no ladder, no handholds except the cable itself, which was damaged and might not hold weight. She looked down. The shaft dropped into darkness below them. If the cable snapped, they'd fall 8 floors onto concrete. Carter made a sound. Not words. Just a wet gurgling that Victoria recognized immediately as the sound of lungs filling with blood. She dropped beside him, rolled him on his side. Blood poured from his mouth. His chest wasn't moving right. One of the sutures had definitely torn, and now he was drowning in his own hemorrhaging. I need to decompress his chest. Now. Victoria grabbed the trauma kit, pulled out a needle meant for tension pneumothorax. Hold him steady. Simmons braced Carter's shoulders. Victoria found the intercostal space by touch, plunged the needle between his ribs. Blood sprayed out under pressure. Carter arched, gasped, started breathing again. Shallow, but present. That bought him maybe 10 minutes, Victoria said. We need to move. Now. She stood, grabbed the cable with both hands. It was sick with grease and rust. She pulled herself up, hand over hand, feet bracing against the shaft wall. Her shoulders screamed. Her hands slipped. She caught herself, kept climbing. 3 feet, 4, 5. Her fingers found the edge of the roof opening. She pulled herself up and over, collapsed on cold asphalt. Stars overhead, cold wind. The city spread out below, lights everywhere, completely unaware that people were dying 8 floors down. She leaned back over the opening. Simmons, I'll pull him up. Get a makeshift harness on him. With what? His clothes, IV tubing, anything. Just make it fast. She heard movement below, Simmons working, then a shout. Ready? Victoria lowered herself back into the shaft, grabbed the makeshift harness, Carter's torn shirt tied around his chest and under his arms. She pulled. He was dead weight, unconscious, his body limp. She got his upper body through the opening, braced her feet, pulled harder. His hips came through, then his legs. He was out. Simmons, your turn. Cable's breaking. I can hear it. If I put weight on it, then don't use the cable. Climb the shaft walls. Push your back against one side, feet against the other. Chimney climb. You can do this. Silence below. Then scuffling. Simmons appeared at the opening, face streaked with grime and blood, arms shaking from effort. Victoria grabbed her, hauled her up. They collapsed on the roof together, gasping. The city hummed around them. Emergency sirens in the distance. Helicopter rotors somewhere. The wind smelled like exhaust and coming rain. Carter wasn't breathing. Victoria started compressions immediately. 30 compressions, 2 breaths. 30 more. 2 more. His chest cracked under her hands, ribs breaking from the pressure. She didn't stop, couldn't stop. Come on, she said through gritted teeth. Come on, Carter. You don't get to die after all this. You don't get to quit on me. His back arched. He gasped. Started breathing on his own, ragged and weak, but breathing. Victoria sat back on her heels, her own breathing harsh. Her hands were shaking now, adrenaline crash hitting hard. They were on a roof, 8 floors up, with a dying federal agent and no way down and hostiles probably already heading up through the building to finish what they'd started. Signal fire, Simmons said. She'd already pulled the alcohol-soaked gauze from the trauma kit, piled it in the center of the helipad. We light it. Someone sees. Someone comes. Or the hostiles see it and know exactly where we are. Then we're dead either way. At least this way we die trying. Victoria looked at Carter, at the city beyond, at the hospital below where Corporal Hayes had bought them time with his life, where Colonel Vance might be dead, where Amanda Cross and her evidence were supposedly destroyed. She grabbed the lighter, flicked it. The flame caught. She touched it to the gauze. The fire bloomed bright and fast, alcohol burning hot. Smoke billowed up, black and thick, visible for miles. They waited. 60 seconds, 90, 2 minutes. Victoria kept her hand on Carter's neck, monitoring his pulse. Still there, still fighting. Then she heard it. Not helicopter rotors, not rescue. the roof access door slamming open. 4 figures emerged, backlit by emergency lighting from the stairwell, all armed, moving with tactical precision toward the signal fire where Victoria and Simmons stood in plain sight. The lead figure stepped into the firelight. Victoria's blood froze. It was Dr. Marcus Reed. He held a service weapon in his right hand, pointed at the ground but ready. His expensive coat was gone. His shirt was torn. His face was streaked with soot and blood, but his eyes were clear, focused, and completely devoid of the arrogance she'd seen earlier. Hayes. His voice was flat, mechanical. Step away from Agent Carter. Reed. Victoria's mind raced. What are you doing then? Following orders. He raised the weapon, aimed at Carter's head. Same thing I've been doing for 18 months. Since Malcolm Brenner recruited me into Project Sentinel. Since I started identifying vulnerable patients for the trials. Since I realized this hospital was never about healing people. It was about testing how far we could push the human body before it broke. Behind him, the 3 other figures moved into position. Not military, not hostiles from the basement, hospital staff. Victoria recognized 2 of them, nurses who'd worked the night shift with her for years. The third was someone from administration, all of them armed, all of them pointing weapons at Victoria. You. Victoria couldn't process it. You've been part of this the whole time. Not willingly, not at first. Reed's hand shook slightly. But they offered me research opportunities, funding, access to experimental protocols that could revolutionize combat medicine. All I had to do was look the other way. Select the right patients, make sure nobody asked too many questions. He swallowed hard. And then it was too late to stop, too deep, too complicit. So I kept going. You let people die. Victoria's voice was shaking now, rage overwhelming shock. You let me save Carter tonight because you needed him alive long enough to find out what evidence he had. You played victim while coordinating with the people trying to kill him. I did what I had to do to survive. Reed's weapon steadied. And now I'm finishing it. Carter dies. You die. Major Simmons dies. The evidence was destroyed hours ago. No witnesses, no proof. Project Sentinel stays buried and I get to keep my career and my life. He looked at the nurses flanking him. Do it. They hesitated. Now, Reed screamed. Victoria moved on pure instinct, grabbed a piece of broken rebar from the rooftop debris and threw it at the nearest nurse. It hit her shoulder, knocked her aim wide. The gunshot went wild, punching a hole in the air 6 inches from Victoria's head. Simmons lunged at Reed. He turned, fired. The round caught her in the thigh. She went down hard. Victoria dove for Simmons' position, grabbed her, started dragging her behind the rooftop mechanical equipment. Reed fired again. Again. Rounds sparked off metal housing. You can't hide up here forever, Hayes, Reed's voice cracked with stress. There's nowhere to go. No backup coming. Just accept that you lost and die with some dignity. Victoria pulled Simmons behind an air conditioning unit. The major was conscious, clutching her leg, blood pulsing between her fingers. Arterial hit. Bad, but not immediately fatal. Victoria ripped off her own shirt, used it to apply pressure. Simmons bit back a scream. Carter? Simmons gasped. They'll execute him. Victoria looked around the unit. Carter was still on the helipad, unconscious, defenseless. Reed and his accomplices were moving toward him in a loose formation, weapons ready. She had nothing. No weapon, no backup, no options. Just rage and exhaustion and the memory of 17 soldiers she'd kept alive against impossible odds. Make it 18. Victoria stood up and walked out from behind the air conditioning unit with her hands raised. Reed spun toward her, weapon tracking. Don't move! I'm not armed. I'm surrendering. She kept walking forward, slow and steady. You win, Reed. Just let Simmons live. She's not a threat. Let her go and I'll, You'll what? Beg? Apologize for making me look incompetent? Reed laughed, high and unhinged. You think I care about your surrender? You're a witness. You die. That's the only... The helicopter appeared from nowhere. Not a news chopper, not police. Military Black Hawk. It dropped from altitude like a falling anvil, rotors screaming, spotlight blazing to life and pinning Reed and his accomplices in blinding white light. A voice boomed from loudspeakers. Drop your weapons! Federal agents, drop your weapons now! Reed looked up, squinting into the light. For a moment, Victoria thought he might actually surrender, might actually choose to live. Then he turned his weapon toward Carter and pulled the trigger. The shot never landed. Sniper fire from the helicopter caught Reed in the chest, spinning him backward. He hit the rooftop and didn't move. The three accomplices dropped their weapons immediately, hands raised, screaming surrender. The helicopter landed on the helipad, rotors still turning. The side door opened and Colonel Vance jumped out, bloody, limping, but alive. Behind him came Amanda Cross, holding a camera and looking like she'd been through a war. "Hayes!" Vance shouted over the rotor noise. "You alive?" Victoria stood there, hands still raised, her mind refusing to process what she was seeing. "You're dead, both of you." They said they lied. Amanda Cross moved past Vance, camera recording everything. The USB drive they destroyed was empty, a decoy. The real evidence is already in the hands of every major news outlet in the country. Has been for 2 hours. I uploaded it to the cloud before I ever set foot in your hospital. Vance moved to Carter, checked his vitals. "He's alive, barely. We need medevac now." More helicopters appeared. Actually military this time. Actual rescue. Medics jumped out with stretchers and equipment. They swarmed Carter, started working with the kind of organized efficiency that said he might actually survive the night. Victoria watched it all happening like she was outside her own body. Watched them load Carter into one helicopter. Watched them treat Simmons' leg wound. Watched federal agents cuff the surviving accomplices and drag them away. Someone wrapped a blanket around her shoulders. Someone else was asking questions she couldn't hear over the ringing in her ears. Amanda Cross stood in front of her, camera off now, just looking at her with something like respect. "He's gonna make it, because of you. They all will. Hayes!" Vance's voice. She turned. He looked exhausted and furious and relieved all at once. Dr. Reed wasn't working alone. The other names from Project Sentinel, the people at the top who organized this, they're scrambling right now. Lawyers, political connections, they're going to fight this with everything they have. He paused. "We need you to testify. All of it. Everything you saw tonight. Everything you know about how this hospital operates. Will you do it?" Victoria looked down at her hands, still steady, still covered in Carter's blood and her own sweat. The hands of Captain Scarlett Hayes, combat medic, the woman who couldn't walk away from fights she should have avoided. "Yes," she said. Vance nodded, started to turn away, then stopped. "One more thing. Private James Carter? The kid you saved in Kandahar?" He pulled out his phone, showed her a message. "He woke up 20 minutes ago. First thing he said was, 'Tell Captain Hayes I'm still working on that paperwork.'" Victoria almost smiled. Almost. Then she looked past Vance to where Dr. Reed's body lay covered on the rooftop, and the smile died before it formed. Because somewhere in this city, the people who'd orchestrated Project Sentinel were watching the news coverage. Watching their conspiracy collapse in real time. Watching as their carefully constructed empire of corruption started burning. And they were making their own plans for how to respond. The federal building in downtown Denver smelled like old carpet and institutional coffee. Victoria sat in a conference room on the 9th floor, staring at photographs spread across the table like evidence from a crime scene, which technically they were. 43 faces, 43 veterans who'd trusted the system and died for it. Some young, some old, all dead before their time because someone decided profit mattered more than human life. 3 days had passed since the rooftop. 3 days of interviews, depositions, medical examinations, and federal agents treating her like she was simultaneously a hero and a potential liability. She'd slept maybe 6 hours total, all of it in borrowed beds in safe houses where armed guards stood outside, and nobody would tell her if Carter was still alive. Assistant U.S. Attorney Rachel Kessler sat across from her now, early 40s, sharp suit, the kind of exhaustion in her eyes that said she'd been working this case non-stop. "We need you to walk through it again, everything Reed said on that rooftop, word for word. I've already given 3 statements, and defense attorneys will pick apart every inconsistency, so we go through it until there aren't any." Kessler pushed a legal pad across the table. "Start with when he first appeared from the stairwell." Victoria picked up the pen. Her hand was steadier now than it had been on the roof, steadier than it had any right to be. She started writing. Reed's words came back with uncomfortable clarity. The confession, the justification, the moment when he'd chosen execution over surrender. The door opened. Colonel Vance entered with someone Victoria didn't recognize, A woman in her 50s wearing a tailored charcoal suit and an expression that could freeze nitrogen. Her ID badge read, Department of Defense. Captain Hayes? The woman sat down without invitation. I'm Deputy Director Sarah Wolf, Defense Criminal Investigative Service. We have a problem. Victoria set down her pen. What kind of problem? The kind where Malcolm Brenner is claiming he was coerced into participating in Project Sentinel. Says he was threatened, blackmailed, forced to cooperate under duress. His attorneys are painting him as another victim. Wolf pulled out a tablet, showed Victoria a news clip. Brenner, in a suit on courthouse steps, surrounded by expensive lawyers, looking convincingly terrified. He's flipping the narrative, says the real architect of Project Sentinel is someone else, someone higher up the chain. Who? He won't say. Not without full immunity and witness protection. Wolf's jaw tightened. His lawyers leaked just enough to the media to make it credible. Defense contractors are distancing themselves. Congressional oversight committees are demanding hearings, and the Secretary of Defense is receiving calls from senators asking why the military is prosecuting a whistleblower. Victoria stared at the screen, at Brenner's performance. The man who'd facilitated 43 murders was about to walk free because he had better lawyers and a better story. That's not happening, she said quietly. It's already happening. Kessler shuffled papers. Unless we can prove Brenner was a willing participant, not a coerced victim, his testimony becomes our best shot at reaching whoever actually organized this, which means we cut a deal. No. Captain, I understand your feelings, but I said no. Victoria stood. Her chair scraped backward. Brenner selected patients, falsified records, facilitated access for people who murdered veterans in hospital beds. He wasn't coerced. He was greedy and ambitious, and he didn't give a damn who died as long as he got his research funding. Can you prove that? Wolf asked. Carter can, if he's alive, which nobody will tell me. Vance and Wolf exchanged glances. Wolf nodded slightly. Vance pulled out his phone, turned it toward Victoria. A video call connected. The screen showed a hospital room, clean and bright, and in the bed, pale but breathing on his own, was James Carter. Captain, his voice was weak but clear. Heard you've been asking about me. Victoria's throat closed. She'd been preparing herself for him to be dead, had been building walls against that grief. Seeing him alive cracked something inside her chest. You look terrible, she managed. You should see the other guy. Oh wait, he's dead. You saw that happen. Carter tried to smile. Failed. They told me about Reed, about Brenner trying to flip. I've been going through every piece of evidence I collected during my undercover work. Financial records, email intercepts, recorded conversations. He paused. I've got proof Brenner wasn't coerced. He initiated contact with Redstone Defense Solutions. He proposed using Ridgemont Memorial as a test site. He even provided a cost-benefit analysis showing how veteran deaths would be attributed to service-related complications instead of experimental drug trials. Wolf leaned forward. You have documentation of this? Encrypted files, multiple redundant backups. I can walk prosecutors through every transaction, every communication, every decision Brenner made that proves he was a willing architect of this conspiracy. Carter's eyes found Victoria's. But I need something in exchange. Name it, Wolf said. Captain Hayes gets full protection. Not witness protection, actual protection. The people behind Project Sentinel are still out there. They're going to come after everyone who helped expose this. I want military security assigned to Hayes until every single person involved is in custody or dead. That's not, Victoria started. Non-negotiable, Carter interrupted. You saved my life 3 times. I'm not letting someone kill you because I dragged you into this. Wolf considered. Agreed. Captain Hayes receives protection detail effective immediately. She looked at Victoria. Which means you'll be under constant surveillance for the foreseeable future. Armed guards, restricted movement, no privacy, no normal life. Are you comfortable with that? Victoria thought about her apartment that she hadn't seen in 3 days. Her car still parked at Ridgemont Memorial. Her quiet life that had already burned to nothing. Does it matter if I'm comfortable? Not particularly, but I like to ask. Wolf stood. Agent Carter, we'll coordinate with your security team to arrange evidence transfer. Captain Hayes, you're with me. We have a meeting. With who? Malcolm Brenner's defense team. They've agreed to a pretrial conference. Apparently they want to see if we're willing to negotiate before this goes public. Wolf's smile was sharp and cold. We're going to explain why that's not happening. The law office was in a glass tower downtown, 30th floor, floor-to-ceiling windows with views of the mountains. Brenner's legal team had clearly spared no expense. 5 attorneys in suits that cost more than Victoria made in a month. Brenner himself sat at the head of the table, looking smaller than he had on the news. Older. His confident polish had cracked, revealing something desperate underneath. His lead attorney, a silver-haired man named Whitmore, stood as they entered. Deputy Director Wolf, thank you for agreeing to meet. I think we can reach an arrangement that serves everyone's interests. I doubt that. Wolf sat. Victoria remained standing near the door, flanked by 2 federal agents. But I'm willing to listen. Whitmore launched into what was clearly a rehearsed pitch. Brenner as victim. Brenner as hero for coming forward. Brenner's willingness to testify against the real villains in exchange for immunity. It was smooth, professional, and built on carefully crafted lies. Halfway through, Victoria's phone buzzed. A text from an unknown number. Check your email. Now. She pulled out her phone, opened her email. Found a message from an address she didn't recognize. The subject line read, "From Corporal Hayes. He said you'd want to see this." Her breath caught. Corporal Hayes. The young medic who'd stayed behind in the basement to buy them time, who they'd all assumed was dead. The email contained a single video file. She opened it. Shaky footage, clearly recorded on a phone, showed the basement room from a corner angle. Hayes must have set his phone to record before the final assault. The video showed the firefight, showed Hayes firing until his magazine ran dry, showed the grenade that filled the room with smoke and fire. Then, after the explosion cleared, it showed 2 things. Hayes, injured but alive, crawling toward the ventilation shaft, and a conversation between the hostiles who'd breached the room. Target's gone. Use the ventilation system. Brenner's going to lose his mind. He promised this would be clean. Brenner can handle the political fallout. Our job is finding them before they reach anyone who matters. Split up. Cover all possible exit points. The video ended. Victoria looked up. Brenner's attorney was still talking, something about prosecutorial overreach. She interrupted him. "Mr. Brenner." Her voice cut through the room like broken glass. How did the strike team know to breach the basement at that exact moment? How did they know which room we were in? The hospital was in lockdown. Communications were restricted, military personnel only. She paused. Unless someone gave them real-time updates, someone with access to security feeds and floor plans, someone like the hospital's chief operating officer. Brenner's face went white. Whitmore stepped in immediately. My client will not respond to inflammatory accusations without, I'm not accusing. I'm stating facts that will be entered into evidence. Victoria looked at Wolf. Corporal Hayes survived the basement assault. He's in federal custody right now, along with video evidence proving Brenner coordinated with the strike team, which means Brenner didn't just facilitate the trials. He actively participated in attempted murder of federal witnesses. The room went silent. Brenner's hands were shaking now, all pretense of calm gone. Wolf stood slowly. Mr. Whitmore, your client's immunity offer is rejected. Malcolm Brenner will be charged with conspiracy to commit murder, obstruction of justice, and violations of federal witness protection statutes. If convicted, he's looking at life without parole. She moved toward the door. We're done here. Wait! Brenner's voice cracked. He grabbed the table edge, knuckles white. Wait, you don't understand. I can't go to prison. They'll kill me. The people who organize Project Sentinel, they have reach everywhere. Federal prisons, state facilities, nowhere safe. You're signing my death warrant. Should have thought of that before you helped murder 43 veterans, Victoria said flatly. I didn't want to. Brenner's composure shattered completely. I never wanted any of this. But they had leverage, information, things that would have destroyed my career, my family, everything. I didn't have a choice. Everyone has a choice, Wolf said. You made yours, repeatedly. Brenner looked at Victoria with genuine terror. You have to understand. The person behind this, they're not some mid-level bureaucrat. This goes higher than you think, higher than defense contractors, higher than Senator Catherine Novak. The new voice came from the doorway. Everyone turned. Amanda Cross stood there with her camera crew, recording everything. Behind her, 2 FBI agents were restraining Brenner's security. Senator Catherine Novak, Amanda repeated. Chair of the Armed Services Committee, recipient of $7 million in defense contractor donations over the last 3 years, primary sponsor of legislation that deregulated military medical testing protocols. She walked into the room like she owned it. I've spent the last 72 hours following the money trail in Carter's evidence files. Every payment, every transaction, every offshore account. They all trace back to shell companies owned by Senator Novak's husband's firm. Brenner looked like he might pass out. Whitmore was shouting about illegal recordings and attorney-client privilege. Victoria just watched Amanda work, laying out the conspiracy with receipts and documentation and the kind of ironclad proof that couldn't be dismissed. Senator Novak? Wolf's voice was carefully controlled. You're certain? Completely. I've got bank records, encrypted emails, testimony from 3 whistleblowers who worked in her office. She orchestrated Project Sentinel as a way to funnel military research funding to private contractors who donated to her campaigns. Brenner was her inside man at Ridgemont Memorial. Reed was her safety valve, someone who could clean up loose ends if the trials went wrong. Amanda pulled out a tablet, showed photos of Reed meeting with someone outside the hospital. The someone was wearing sunglasses and a coat, but the face was recognizable. Senator Catherine Novak. This was taken 6 weeks ago, Reed receiving instructions for how to handle Agent Carter when he arrived undercover. Victoria felt something cold settle in her chest. Reed hadn't just been corrupt. He'd been following orders from the 3rd most powerful person in the Senate. Where is she now? Wolf asked. Washington. Her office issued a statement an hour ago denying all involvement, called it a conspiracy theory. Her attorneys are already filing defamation suits. Amanda smiled grimly. But the evidence is airtight. FBI's already preparing arrest warrants. Should be executed within 6 hours. Wolf pulled out her phone, made a call, spoke quietly, hung up. Confirmed. FBI's moving. Senator Novak will be in custody before midnight. Brenner started crying. Not sophisticated tears, ugly, desperate sobbing. His attorneys looked at each other, clearly realizing their payday had just evaporated. Victoria walked out of the conference room. The hallway outside was quiet, carpeted, expensive. Through the windows, she could see Denver stretching toward mountains. Somewhere down there, Ridgemont Memorial Hospital was probably swarming with investigators. Somewhere, families of 43 dead veterans were learning their loved ones' deaths hadn't been natural. Somewhere, James Carter was recovering in a hospital bed, probably watching this same story unfold on the news. Amanda joined her at the window. You okay? No? Victoria's voice was flat. I just found out my boss was taking orders from a United States senator to help murder veterans. I'm not sure I'll ever be okay again. Fair. Amanda was quiet for a moment. For what it's worth, you're the reason this story broke. Without you keeping Carter alive, without your testimony, Brenner and Reed and Novak all walk. They keep killing people, and nobody ever knows. Corporal Hayes kept Carter alive, Major Simmons, Colonel Vance. You just performed battlefield surgery in an emergency room, survived multiple assassination attempts, climbed through a condemned ventilation shaft while keeping a dying man stable, and stared down a corrupt doctor on a rooftop. Stop deflecting. You saved lives. Accept it. Victoria almost smiled. Almost. You always this direct with people? Only when they're being stubborn about their own heroism. Amanda's phone buzzed. She checked it. FBI just arrested Senator Novak at her home. Agents found evidence she was planning to flee to a non-extradition country. Looks like your testimony spooked her into running early. Good. Victoria turned from the window. What happens now? Now? Trials, lots of them. You'll be testifying for months, maybe years. Every news outlet in the country is going to want interviews. You're going to be famous whether you want to be or not. Amanda paused. The hospital board at Ridgemont Memorial issued a statement 2 hours ago. They're offering you your job back, with apologies, full back pay, promotion to senior trauma nurse, benefits. The works. Victoria thought about the emergency department, the fluorescent lights, the overnight shifts, Dr. Reed's condescension. Except Reed was dead now, shot by a military sniper. The hospital was under federal oversight. Everything had changed. I don't want it, she said. What do you want? Good question. Victoria had spent 6 years wanting to be invisible, and that was gone forever. She'd spent 3 days wanting Carter to survive, and he had. She'd spent 6 hours wanting Brenner and his co-conspirators to face justice, and it was happening. What did she want now? A shower, she said finally. 12 hours of sleep, and a very large drink. I can help with 2 of those. Amanda grinned. Come on, I know a bar that serves military and press. Nobody will bother you there. They walked toward the elevator. Behind them, Victoria could hear Brenner's attorneys arguing with federal agents about custody arrangements. Heard Brenner himself still crying, the sound echoing off expensive walls. She felt nothing for him. No pity, no satisfaction, just exhaustion and the weight of decisions that had kept people alive and gotten others killed. The elevator doors opened. They stepped inside. As the doors closed, Victoria caught a glimpse of Wolf down the hallway, phone pressed to her ear, coordinating what was probably the biggest military corruption case in decades. She seems intense, Amanda said. She's effective. That's what matters. Spoken like a soldier. Ex-soldier. Are you, though? Amanda looked at her. Ex-soldier? Because from where I'm standing, you just executed a military operation that saved lives and exposed a massive conspiracy. That's not ex-soldier behavior. That's just soldier behavior without the uniform. The elevator descended. Victoria watched the numbers drop. 30th floor. 25th. 20th. Each number ticking down like a countdown to something she couldn't name. Her phone buzzed. Another text from the unknown number. Captain, this is Hayes. Corporal Hayes. I'm okay. Legs messed up, but I'll walk. Wanted you to know. Also wanted to say thank you for teaching us that saving lives matters more than following orders. You probably don't remember me from training, but I remember you. We all do. Victoria read it twice, felt something crack in her chest that had been solid for years. You crying? Amanda asked gently. No. Victoria wasn't, but her eyes were burning and her throat felt tight and something in her had shifted permanently. I thought he was dead. The grenade. The explosion. I thought we left him to die. You gave him a chance to survive by getting Carter out. He made that chance count. The elevator hit the ground floor. The doors opened. That's all any of us can do. Give people chances. Hope they make them count. They walked through the lobby toward the exit. Outside, the sun was setting, painting Denver in orange and gold. News vans were parked across the street. Reporters doing live shots about Senator Novak's arrest. Victoria pulled her jacket hood up, kept her head down. Nobody noticed her. Just another person leaving a building in a city full of buildings. Amanda's bar was 3 blocks away. Basement entrance. No sign. Inside it was dark and quiet, filled with people who looked like they'd seen things they didn't want to discuss. Perfect. They found a booth. Amanda ordered 2 whiskeys. They arrived fast, poured heavy. To Corporal Hayes, Amanda said, raising her glass. And Major Simmons, and Colonel Vance, and James Carter, and 43 veterans who deserved better. Victoria clinked glasses. Drank. The whiskey burned going down, settled like fire in her stomach. She ordered another immediately. Easy, Amanda said. When's the last time you ate? Victoria tried to remember. Couldn't. 3 days ago? Maybe? Jesus, okay, we're getting you food. Amanda flagged down a server, ordered burgers. They arrived fast, greasy, perfect. Victoria ate mechanically, barely tasting it. Her body needed fuel. She was providing fuel. That was enough. Halfway through the burger, her phone rang. Unknown number. She almost didn't answer. Then something made her pick up. Captain Hayes? The voice was female, older, tired. This is Margaret Diaz. My son was Private First Class Tommy Diaz. He died 3 years ago at Ridgemont Memorial. They told us it was complications from his injuries in Afghanistan. A pause. I just saw the news. About Project Sentinel. About what they did to veterans. Her voice broke. Was my son? Did they... Victoria closed her eyes. Checked the name against the list she'd memorized. Private First Class Thomas Diaz. Admitted to Ridgemont Memorial for treatment of combat-related injuries. Died 2 weeks later. Cause of death listed as septic shock. But the autopsy showed unusual drug compounds in his system, compounds consistent with Project Sentinel trials. Yes, ma'am, Victoria said quietly. Your son was a victim of the illegal trials. I'm sorry. Silence on the line, then quiet crying. They killed my baby. They said he was a hero. They gave us a flag and a medal and they killed him. Yes, ma'am. Will they pay, the people who did this? They're being arrested as we speak. They'll go to trial. They'll face justice. Because of you? The news said a nurse exposed everything. Was that you? Victoria looked at Amanda, who was watching her with an unreadable expression. I helped, but a lot of people contributed. Agent Carter, military investigators, journalists. Your son's death mattered. It helped us build the case. Thank you. Margaret Diaz's voice was steady now, determined. Thank you for fighting for him. For all of them. The call ended. Victoria set down her phone, stared at her half-eaten burger. Couldn't pick it up again. You okay? Amanda asked. 43 families. They're all going to call. They're all going to want answers. Want someone to blame. Want justice. Victoria's hands were shaking now, delayed shock finally hitting. I'm not equipped for this. I'm a combat medic. I keep people breathing. I can't. Hey. Amanda reached across the table, grabbed Victoria's hands, held them steady. You don't have to do this alone. The Federal Victim Services will handle family outreach. Therapists will help them process. You just have to keep doing what you've been doing, telling the truth, being honest about what happened. And if the truth is that their sons and daughters and husbands died because I spent 6 years keeping my head down instead of asking questions, what do I tell them then? You tell them you didn't know, because you didn't. Reed and Brenner and Novak worked very hard to make sure nobody knew. Blaming yourself doesn't help those families. It just makes you another victim. Victoria pulled her hands back, picked up her whiskey, finished it in one swallow. I need to get out of here. Okay, where? I don't know. Anywhere. I need to move. They paid and left. Outside, the city had transitioned to night. Traffic hummed. People moved on sidewalks, living normal lives, completely unaware that miles away, a United States senator was being processed into federal custody for orchestrating medical experiments on veterans. Victoria walked without direction, Amanda staying close but giving her space. They ended up at a park along the river, empty except for joggers and a few homeless people sleeping on benches. Victoria sat on a bench facing the water. Amanda sat beside her. You know what the worst part is? Victoria said finally. I left the military because I testified about command failures, told the truth about decisions that got soldiers killed, and they buried me for it, made me radioactive. I learned that telling the truth destroys you. She paused. So I spent 6 years hiding, being nobody, keeping quiet. And it turned out that keeping quiet also destroys you, just slower, maybe. Amanda was quiet for a moment. Or maybe you were waiting, building skills, surviving. So that when the moment came, when someone needed you to be Captain Hayes instead of just Hayes the nurse, you'd be ready. I wasn't ready. I'm still not ready. Nobody ever is. But you did it anyway. Amanda stood. Come on. I'm taking you to the safe house. You need sleep, real sleep. The world can wait 12 hours. Victoria let Amanda lead her back to a car. Let federal agents drive them to a house in the suburbs with guards outside and blackout curtains on the windows. Let someone show her to a bedroom with clean sheets and a bathroom with actual water pressure. She showered for 20 minutes, washing off 3 days of blood and smoke and terror. Got out. Looked at herself in the mirror, same face, same exhausted eyes. But something had changed. Some internal recalibration that she couldn't name but could feel settling into her bones. She dried off, collapsed into bed, expected nightmares, expected to see Reed's face or Corporal Hayes' grenade or Carter bleeding out on a ventilation shaft. Instead, she dreamed of nothing, just darkness and silence and peace. When she woke, sunlight was streaming through gaps in the curtains. Her phone showed 14 hours had passed. She had 73 missed calls and 200-plus text messages. She ignored all of them and went downstairs. Amanda was in the kitchen making coffee. Morning, or afternoon technically. You hungry? Starving. Good. Because we have a problem. Amanda handed her the coffee, then showed her a tablet. News coverage. Senator Novak's arraignment, federal prosecutors laying out charges. And buried in the third paragraph, defense attorneys for Senator Novak have filed motions to suppress evidence obtained through testimony of Captain Victoria Hayes, claiming her military discharge was dishonorable and her testimony unreliable due to mental health concerns. Victoria read it twice. Her discharge paperwork had been classified, sealed. The only way Novak's attorneys could have that information was if someone in the Defense Department had leaked it. "They're trying to discredit you," Amanda said. "Make you look unstable, unreliable. If they succeed, everything you testified about gets thrown out. The case falls apart. My discharge was honorable. I have the paperwork. But they're going to argue otherwise. Plant doubt. That's all defense attorneys need. Reasonable doubt that their client was railroaded by an unstable witness with an axe to grind." Amanda set down the tablet. "Which means you need to go public, tell your story, explain why you left the military, take away their ability to control the narrative." Victoria thought about Kandahar, about the testimony she'd given, about the 3 soldiers who died because a colonel decided saving face mattered more than calling for extraction, about the hearing where she'd told the truth and been labeled a troublemaker, a malcontent, someone with an agenda. "If I do that," she said slowly, "everything comes out. The mission, the testimony, the reason I disappeared. Yes, the military will hate me for it. Veterans groups, politicians, everyone who wants to believe the system works." "Probably." Victoria drank her coffee, thought about Margaret Diaz crying on the phone, about 43 families who deserved answers, about Corporal Hayes and his shattered leg and his message thanking her for teaching them that saving lives mattered more than following orders. "Set it up," she said. "Whatever interview reaches the most people, I'll tell everything." Amanda smiled. "Already did. 60 Minutes. Tomorrow night. Prime time. 40 million viewers. You're very confident. I know a good story when I see one. And Captain, this is the best story I've ever covered." Amanda's phone buzzed. She checked it. Her expression changed. "We have a bigger problem. Senator Novak just posted bail. $2 million. She's free pending trial." Victoria's blood went cold. "She's going to run. Or she's going to tie up loose ends." Amanda's voice was grim. "You, Carter, Corporal Hayes, Major Simmons, everyone who can testify against her. If she eliminates the witnesses, the case collapses." "Where's my protection detail?" "Outside, but Hayes—" Amanda hesitated. "Novak has resources, connections, money. If she wants you dead badly enough, eventually she'll find a way." Victoria set down her coffee, walked to the window. Outside, 2 federal agents stood near a black SUV, alert but not expecting immediate threat. Beyond them, the suburban street looked normal, safe, ordinary. But somewhere in this city, a United States senator who'd orchestrated medical experiments on veterans had just walked free. And that senator knew exactly who'd exposed her crimes. Victoria's phone buzzed. Unknown number. She answered. "Captain Hayes." The voice was smooth, cultured, instantly recognizable from news coverage. "Senator Catherine Novak. I think we need to have a conversation, just the 2 of us, about how we can resolve this situation without further damage to either of our reputations." Victoria's hand tightened on the phone. "I'm not interested in negotiating with someone who murdered 43 veterans." "Allegedly murdered. That's the key word, Captain. Allegedly. Because without testimony from you and Agent Carter and that brave corporal who survived the basement, without that testimony, there's no case, just speculation and circumstantial evidence." A pause. "I'm offering you a choice. Walk away. Disappear again. I'll make sure you're well compensated. Set for life. All charges against you dropped. Clean slate. And if I refuse, then I'll destroy you the same way I destroyed everyone else who threatened me. Your military record will be leaked. Every mistake you ever made. Every decision that got someone killed. By the time my attorneys finish, you'll be unemployable, unhirable. A cautionary tale about unstable veterans who crack under pressure." Novak's voice turned cold. "This is your last chance to walk away, Captain. I suggest you take it." The line went dead. Victoria stood at the window, phone in hand, watching the federal agents outside, watching the ordinary street, watching the ordinary people living ordinary lives. Then she turned to Amanda. "Change of plans. Forget 60 Minutes. I want to do the interview now. Live stream. No editing. No delays. I want to tell everything before Novak has time to move against us. Amanda's eyes widened. Are you sure? No, but I'm doing it anyway. Victoria pulled on her jacket. Make the call. We're going public. Now. Amanda made 3 phone calls in under 2 minutes. By the 4th, she was coordinating camera equipment and satellite uplinks while Victoria watched federal agents outside scrambling to adjust security protocols for an unscheduled media event. The safe house living room transformed into a makeshift studio. Lighting equipment materialized from nowhere. A camera appeared on a tripod. Someone tested audio levels while Amanda typed frantically on her laptop. We're going live in 8 minutes, Amanda said without looking up. Streaming simultaneously on YouTube, Twitter, Facebook, and my publication's website. No delay, no filter. Once you start talking, everything you say is permanent and public. Victoria sat in the chair they'd positioned near the window. Her hands were steady. Her pulse was elevated but controlled. She'd done combat triage under mortar fire. She could handle a camera. What do I say? She asked. The truth. Start to finish. Who you were. What you saw. Why you left. What happened at Ridgemont Memorial? Everything Novak threatened to leak? You leak it first. Take away her weapons. Amanda finally looked up. And Captain? Don't pull punches. This isn't a military briefing. It's a story about people who got betrayed by the system that was supposed to protect them. Make people feel that. The countdown started. 5 minutes. Victoria smoothed her shirt, borrowed, too big, but clean. Her hair was pulled back in the same tight style she'd worn for 6 years at the hospital. Her face was makeup-free, exhaustion visible in every line. She looked like exactly what she was, a woman who'd been through hell and refused to stay quiet about it. 60 seconds, someone called out. Amanda positioned herself behind the camera. I'll be asking questions to keep things moving, but if you need to just talk. I'll follow your lead. 30 seconds. Victoria's phone buzzed one final time, a text from James Carter. Watching from the hospital. You've got this, Captain. Make them listen. 10 seconds. The red light on the camera blinked on. Amanda nodded. They were live. Good evening. I'm Amanda Cross, investigative journalist with the Denver Times. I'm here with Victoria Hayes, the nurse whose testimony exposed Project Sentinel, a military conspiracy that resulted in the deaths of at least 43 veterans. Captain Hayes, thank you for speaking with us. Victoria looked directly into the camera. Somewhere out there, millions of people were watching. Margaret Diaz was watching. Senator Novak was watching. Everyone who dismissed her as just a nurse was watching. 6 years ago, Victoria began, I was Captain Scarlett Hayes, United States Army, combat medic. I served 3 tours, saved lives, earned commendations. Then I testified about command failures that killed 3 soldiers under my care, and the military buried me for it. Not officially, my discharge was honorable, but I was blacklisted, made radioactive. The message was clear. Telling the truth about people in power will destroy your life. Her voice was steady, clinical, the same tone she used when documenting trauma cases. So I disappeared, changed my name legally, moved to Colorado, became a night shift nurse at Ridgemont Memorial Hospital, kept my head down, let arrogant doctors treat me like I was incompetent, took their insults, accepted their contempt. Because I thought staying invisible was how you survived. She paused. I was wrong. Amanda leaned forward. What changed? James Carter, a federal agent I'd saved once before in Kandahar. He was brought into my emergency room 3 days ago, dying from an ambush meant to kill him and destroy evidence he'd collected about illegal medical experiments on veterans, experiments conducted at my hospital, using patients I'd cared for. Victoria's jaw tightened, and I realized that 6 years of keeping quiet had accomplished nothing. People were still dying, corruption was still thriving, and my silence was complicity. She walked through it methodically. Dr. Reed's dismissal of her warnings. The emergency surgery that saved Carter's life. The assassination attempts. The rooftop confrontation where Reed confessed to participating in Project Sentinel. Malcolm Brenner's coordination with strike teams. And finally, the money trail that led straight to Senator Catherine Novak. Senator Novak called me an hour ago, Victoria said. Offered me money to disappear, threatened to destroy my reputation if I didn't. She said she'd make sure everyone knew about every mistake I ever made, every decision that got someone killed. She looked directly into the camera. So I'm going to tell you myself before she can weaponize it. She described the mission in Kandahar, the convoy ambush, the colonel who delayed extraction because he didn't want to admit tactical failure, 3 soldiers who died waiting for help that came too late. Her testimony at the hearing, the retaliation that followed. I made mistakes, she said quietly. I couldn't save everyone. Some people died despite my best efforts. That's combat medicine. You do impossible things with insufficient resources, and sometimes you lose anyway. But I never lied about it. I never covered up failures to protect my career. And when I saw people in power doing exactly that, I spoke up. She paused. The military taught me that speaking up makes you a target. Project Sentinel taught me that staying silent makes you complicit. There's no safe option. You either fight for what's right and accept the consequences, or you keep your head down and live with the guilt. Ishit was. Her voice cracked slightly. She cleared her throat, continued. 43 veterans died in Project Sentinel trials. Their families were told they died from service-related complications. Natural causes. Unavoidable tragedies. All lies. They died because Senator Catherine Novak wanted to funnel military research funding to defense contractors who donated to her campaigns. They died because Malcolm Brenner wanted prestigious research opportunities. They died because Dr. Marcus Reed couldn't admit a nurse might know more than him. Victoria's hands clenched. They died because people in power decided profit and ego mattered more than human life. And they kept dying because people like me stayed quiet instead of asking questions. Amanda spoke carefully. You're saying you feel responsible. I'm saying I should have noticed sooner. Should have asked why certain patients deteriorated faster than medical science predicted. Should have questioned why veteran admissions spiked after Malcolm Brenner joined hospital administration. I had access to records. I had medical knowledge. I was there. Her voice hardened. But I'd spent 6 years training myself not to notice things, not to question authority, not to make waves. So yes, I feel responsible. Not legally. I didn't know about the conspiracy. But morally, I should have been paying attention. The camera captured everything. Her exhaustion, her anger, her grief. This wasn't a polished media appearance. This was someone bleeding truth in real time. What happens now? Amanda asked. Now I testify. At every trial, every hearing, every proceeding necessary to put Senator Novak and everyone involved in prison for the rest of their lives. She threatened to destroy my reputation. Fine. My reputation was already destroyed 6 years ago. I've got nothing left to lose and 43 families who deserve justice. The stream's viewer count was climbing. 50,000, 100,000, 200,000. Comments flooded in. Support, questions, angry denials from Novak's defenders. Victoria didn't look at them. Senator Novak will argue this is all circumstantial, Amanda said, that you're an unstable veteran with an agenda. Then let me be clear. Victoria leaned toward the camera. I have documentation, medical records, financial transactions, encrypted files from Agent Carter's investigation, testimony from Corporal Hayes, Major Simmons, and Colonel Vance. We have evidence of Senator Novak meeting with Dr. Reed 6 weeks before the convoy attack. We have communications between Brenner and defense contractors discussing asset acquisition, their term for selecting vulnerable veterans to use as test subjects. Her voice dropped to something cold and final. This isn't speculation. It's not a conspiracy theory. It's a documented criminal enterprise that murdered veterans and tried to silence anyone who discovered it, bought it. Amanda's phone was buzzing non-stop. She glanced at it, eyes widening. Captain, social media is exploding. Hashtag Project Sentinel is trending globally. Major news outlets are picking up the stream. And, she paused. The FBI just issued a statement. They're revoking Senator Novak's bail, immediate arrest warrant. They're calling her a flight risk and a danger to witnesses. Victoria felt something release in her chest. Not relief, not yet, but a sense that momentum had shifted, that truth spoken loudly enough could still matter. The doorbell rang. Federal agents moved immediately, weapons drawn. Through the window, Victoria saw 3 black SUVs pulling up. Not hostile. These had government plates and official markings. The lead agent spoke briefly with someone outside, then opened the door. Deputy Director Wolf entered, flanked by FBI personnel. She looked at the camera setup, at Victoria, at Amanda. Her expression was unreadable. "Captain Hayes, we need to pause this interview." "No," Victoria said. "Senator Novak's attorneys are filing emergency injunctions. They're arguing this live stream violates her right to a fair trial. If you continue, you could jeopardize the entire prosecution." "Let them argue." Victoria didn't move from her chair. "I'm not under oath right now. I'm not testifying in court. I'm a private citizen expressing my opinions about public events. First Amendment still applies, last I checked." Wolf's lips twitched, almost a smile. "You're not wrong, but I strongly advise your advice is noted and rejected." Victoria looked at Amanda. "Keep rolling." Amanda's grin was fierce. "You heard the captain." Wolf sighed, pulled up a chair, sat down just off camera. "Then I'm staying. Someone needs to make sure you don't accidentally commit perjury on live television." The stream continued. Amanda asked about the basement firefight, about Corporal Hayes' sacrifice, about the climb through the ventilation shaft with a dying patient. Victoria answered everything, pulling no punches. When she described Reed's confession on the rooftop, the viewer count hit 500,000. Then Amanda asked the question Victoria had been waiting for. "What do you want people to take away from this story?" Victoria was quiet for a long moment. When she spoke, her voice was softer but somehow more intense. "I want people to understand that corruption doesn't survive because evil people are strong. It survives because good people stay quiet, because nurses don't question doctors, because soldiers don't question colonels, because citizens don't question senators." She paused. "I spent 6 years proving that staying quiet doesn't protect you. It just makes you complicit in whatever's happening around you. And when the truth finally comes out, and it always does, you have to live with the knowledge that you could have stopped it sooner but chose comfort over courage." She looked directly into the camera again. "If you're watching this and you see something wrong, in your workplace, in your community, in your government, speak up. Document it, report it, make noise. Yes, you might face retaliation. Yes, you might lose your job or your reputation or your peace of mind. But silence has a cost too. It's just a cost paid by victims instead of witnesses." Her voice strengthened. 43 veterans paid the price for my silence, for Malcolm Brenner's ambition, for Dr. Reed's ego, for Senator Novak's greed. I can't bring them back, but I can make sure their deaths meant something, that their families get answers, that the people who killed them face consequences. The stream had reached 700,000 viewers. Victoria could see Amanda's hands shaking slightly as she typed notes. "Captain Hayes," Wolf said from off camera, "I've just received confirmation. FBI has Senator Novak in custody. She was attempting to board a private plane to Brazil. No extradition treaty." A pause. "You did that. This interview. The public pressure. It forced them to move faster than they planned." Victoria nodded once. "Good. Also," Wolf continued, "I'm authorized to offer you a position with the Defense Criminal Investigative Service. Consulting role. Helping identify and investigate medical corruption in military and VA facilities. Apparently your skill set is desperately needed." She paused. "Pays well. Comes with federal protection. And you'd be reporting directly to people who can't bury you for telling the truth." Victoria considered. A real job. Federal backing. The ability to fight systemic corruption instead of just surviving it. 6 years ago, she would have refused immediately. Would have run from anything that put her back in the spotlight. Now? Now she looked at the camera, at the 700,000 people watching, at the comments flooding in from veterans and families and citizens who were angry and demanding answers. "I'll think about it," she said. The interview wrapped 20 minutes later. Amanda ended the stream with the viewer count at 1.2 million and climbing. The footage would be analyzed, quoted, replayed for months. Victoria's face was now permanently associated with the biggest military corruption scandal in decades. She stood, stretched, felt vertebrae pop. Her entire body ached. When was the last time she'd slept more than a few hours? When was the last time she'd eaten a real meal? She couldn't remember. "You need rest," Wolf said. "Real rest. We have a secure facility where you can recover before the trials start." "I need to see Carter first. He's under guard at Denver Medical Center. I can arrange transport." "Then do it." They drove through the city in an armored convoy, federal agents treating her like she was the president instead of an exhausted nurse who'd gotten pulled into something bigger than she could handle. The hospital was locked down tight, military police at every entrance, metal detectors, ID checks. They escorted her to the fourth floor to a private room where James Carter sat propped up in bed, looking pale but alive. Captain, he tried to sit straighter, winced. Saw your interview, trending on every platform. Senator Novak's been arrested, defense contractors are scrambling. You just detonated a bomb in the middle of Washington. Good. Victoria sat in the chair beside his bed. How are you feeling? Like someone dragged me through a ventilation shaft and then performed surgery in a condemned building. Otherwise great. He smiled weakly. Major Simmons visited yesterday. Said you saved her life on that rooftop. Said she's recommending you for the Soldier's Medal. I'm not military anymore. Civilian Medal of Valor, then. Point is, people are recognizing what you did. What you are. Carter's expression sobered. I heard Wolf offered you a job. You taking it? Maybe. Probably. Victoria looked at her hands, still steady after everything. I spent 6 years hiding from the person I used to be. Turns out you can't actually do that. Eventually, something forces you to choose. Keep hiding or fight back. I'm tired of hiding. It won't be easy. The people you'll be investigating, they're powerful, connected. They'll fight dirty. They already tried to kill me multiple times this week. I think I can handle dirty politics. She stood. Get some rest, Agent Carter. I'll see you at the trials. Hey, Captain? He caught her hand. Thank you. For not leaving me in that convoy truck in Kandahar. For not leaving me in the trauma bay. For not giving up even when everyone else did. His grip tightened. You're the reason I became a federal agent. Wanted to be like you. Someone who fights for people who can't fight for themselves. Victoria's throat closed. She nodded once, pulled her hand free, walked out before he could see the tears she was refusing to cry. Outside, the city sprawled under evening light. Somewhere in federal custody, Senator Catherine Novak was being processed like any other criminal. Malcolm Brenner was probably negotiating a plea deal. The defense contractors were hiring lawyers and preparing statements, and 43 families were finally getting answers about how their loved ones really died. Deputy Director Wolf was waiting by the elevator. Decision made? Yes. Victoria pressed the down button. I'll take the job. But I have conditions. Full access to medical records at every military facility, authority to question anyone regardless of rank, and immunity from retaliation if my investigations implicate people in power. Done. You start in 2 weeks. Take that time to recover. Get your affairs in order. Find an apartment near D.C. Wolf paused. Welcome to the fight, Captain Hayes. Try not to get yourself killed in the first month. The elevator doors opened. Victoria stepped inside. No promises. 2 weeks later, Victoria stood in her new office at the Defense Criminal Investigative Service headquarters outside Washington. The space was small but functional. Desk, computer, filing cabinets, a window overlooking the parking lot. Her credentials hung on the wall. Victoria Hayes, Senior Investigator, Medical Fraud Division. Not Captain Hayes, not just Hayes the nurse. Someone in between. Someone who'd earned the right to exist in both worlds without apologizing for either. Her first case file sat on the desk. A VA hospital in Michigan. Unusual death rates among patients receiving experimental treatments. Financial irregularities in the pharmacy department. And a nurse who'd reported concerns and been immediately transferred to night shift in the records basement. Victoria opened the file, started reading, made notes. Her hands moved with the same steady precision she'd used in trauma bays and combat zones. The work was different, but the mission was identical. Keep people alive, expose the truth, fight for those who couldn't fight for themselves. Her phone buzzed. A text from Amanda Cross. Novak's trial starts in 3 months. You ready to testify? Victoria typed back, yes. Another text, this one from Corporal Hayes. Walking without crutches today. Doctors say I'll be cleared for duty in 6 months. Thank you for everything, ma'am. Another from Major Simmons. Heard you took the DCIS job. Good. Someone needs to burn down the corruption from the inside. Let me know if you need surgical expertise. And finally, one from James Carter. First day back in the field. Tracking defense contractors in Georgia. Feels good to be working again. Still have that paperwork for you, Captain. Guess I need another 40 years to finish it. Victoria smiled. Set down her phone. Looked at the case file in front of her. A nurse in Michigan who'd spoken up and been punished for it. who was probably sitting in that records basement right now, wondering if telling the truth had been worth destroying her career. Victoria knew that feeling intimately. She picked up her phone, dialed the VA hospital in Michigan, asked to speak with the nurse who'd filed the complaint. After 3 transfers and 10 minutes of hold music, a tired voice answered. "This is Nurse Patterson." "Nurse Patterson, this is Victoria Hayes with the Defense Criminal Investigative Service. I'm calling about the concerns you reported regarding patient deaths in your facility." Victoria pulled up files on her computer. "I've reviewed your documentation. It's thorough, detailed, and extremely concerning. I'm opening a formal investigation, and I want you to know you did the right thing by reporting this. It took courage. It might have felt pointless when they retaliated against you, but it wasn't pointless. Someone was listening." Silence on the line, then a shaky breath. "Thank you. I thought no one cared. I thought I'd ruin my career for nothing." "You didn't ruin your career. You started the process of saving lives." Victoria paused. "And Nurse Patterson? When this investigation wraps up and people try to take credit, I'm going to make sure everyone knows it started with you, that you were the one who refused to stay quiet." She hung up, stared at the case file, felt the weight of it settling into her bones alongside Kandahar and Ridgemont Memorial and all the other battles she'd fought and won and lost. The work would be hard, dangerous. She'd make enemies, face retaliation, spend years testifying in courtrooms and congressional hearings. Her face would be attached to every military corruption scandal that came to light. People would call her a troublemaker, a whistleblower, a disgruntled former officer with an agenda. Let them. She'd spent 6 years being dismissed as just a nurse, being treated like she was incompetent and invisible. And in the end, that quiet nurse they'd all underestimated had brought down a United States senator and exposed a conspiracy that reached the highest levels of military and political power. Because the truth, Victoria had learned, didn't care about your rank or your reputation or how loudly you spoke. It just cared about whether you had the courage to speak it at all. She opened her laptop, started typing her first official investigative report. Outside her window, the sun set over Washington, painting the sky in shades of orange and red. Somewhere in this city, corrupt officials were making decisions that would hurt vulnerable people. Somewhere, someone in power was betting that no one would notice or care enough to fight back. They were wrong. Victoria Hayes, former captain, former nobody, current senior investigator, was paying attention now. And she had a very long memory, a complete lack of interest in staying quiet, and absolutely nothing left to lose. The people who dismissed her as just a nurse were about to learn a hard lesson. The most dangerous person in any room is the one who knows exactly how much power they have and has finally decided to use it. She smiled, cracked her knuckles, and got to work.